Okay. Good afternoon, everyone. A warm welcome to each and everyone. God is good all the time. It's a glad welcome we bring to you this afternoon, filled with the desires, hope, and dreams we all share. The happiness of your life depends upon the quality of your thoughts. One small positive thought in the morning can change your whole day. Even solid thing like iron becomes weak when it's hot and people can use it as they wish. So always try to stay cool if you wish to be strong. Cool day with hot coffee, mind filled with thoughts, heart filled with emotions, don't know what is next, but accepting to be the best. Be the best always with your positive thoughts. Jai Hind. With the same positive thoughts, I, Mr. Anand Sampereira, Associate Professor, Department of Medical Surgical Nursing, PANNA Subharti Nursing College, Swami Vivekananda University, welcome you all for the second day of the International Virtual Conference organized by PANNA Subharti Nursing College, Swami Vivekananda Subharti University, Meerut. I hope you all are eagerly waiting for today's session, right? Shall we travel through the ways of knowledge? Here begins the first session of the day, that is clinical nursing leadership through the digital practice stream. Let me introduce the resource person of this session, Dr. M.Kamal Devi, Associate Professor, Director of Education, Alice Lee Center for Nursing Studies, Yong Lo Lin School of Medicine, National University of Singapore. She had completed her Bachelor of Health Science Nursing from University of Sydney, Singapore, her Master of Science, Advanced Practice in Cancer Care with Merit, University of Surrey, United Kingdom, Postgraduate Diploma in Higher Education, Nanyang Technological University, Singapore, and Doctor of Philosophy from National University of Singapore. She's also had a certificate in management, Singapore Institute of Management, Singapore, post-basic certification in oncology nursing, School of Nursing, Singapore, and RN Singapore Nursing Board, Singapore. Her research interest lies in areas of innovation in educational pedagogy, women's health and quality of life, cancer and palliative care, and psychosocial issues. She is a reviewer in local, regional, and international journals, including the International Nursing Review, Asian Bioethics Review, and the Oncology Nursing Forum, and she sits on the editorial board of the Asia Pacific Journal of Oncology Nursing and the Singapore Nursing Journal. She also holds the position as the editor-in-chief of the Singapore Nursing Journal. Dr. Kamla Devi is a board director of the Singapore Nurses Association and a member of the Education Committee of the Singapore Nursing Board. It's being honored to have such a multi-nursing personality, Dr. Kamla Devi ma'am, to be a part of our program. Welcome, ma'am, to have your thoughts to all the nursing professionals and the buds of nurses all over the world on clinical nursing leadership through the digital practice stream. Ma'am, the platform is yours.
Thank you for the kind introduction. And perhaps not to start off, I'll just go on with the presentation. My focus is going to be on clinical nursing leadership through the digital practice realm, and I'm going to share with you about the Singapore perspective. Allow me to just share my screen.
Yeah, yes, ma'am.
The digital realm is embedded in almost everyone's everyday lives. We have digital television, mobile technology with constant internet access, GPS, high quality audio, video technologies, and that has transformed the social media platforms and practices. Over the years, it has paved its way into healthcare, nursing, and the lives of nurses. What is the impact of digital infrastructure on clinical nursing, education, and leadership? As mentioned, allow me to share the perspective from Singapore at this conference. I will begin with care transformation. Nurses in Singapore are using a computer of wheels, or the cow as we very fondly call them, back home with the medication chart cart. It allows us to assess the patient's records and also track the vital signs. The vital signs readings are transmitted wirelessly and captured. And this process was traditionally done using pen and paper. With the use of this device, we have now been able to save more than 3,000 nursing care hours every month in an 800 bedded hospital, as nurses now do not have to record the information from the vital signs monitoring done. To move on, we've also embarked on the electronic medical record system. Healthcare is very reliant on data on a day to day basis, and the healthcare team is recording numerous information, vital signs, diagnostic test results, and clinical notes. But this data becomes more useful when it's digital and it is accessible. We actually began the journey with digitalizing financial data in the hospitals as early as in the 1980s, to now having a progressive extension of the functionality over the years. It has been an arduous journey for us: blood, sweat, and of course, tears. But nevertheless, the efforts have paid off. The digitalization process has facilitated information sharing and collaboration between the doctors, the nurses, the clinical staff, hospitals, and clinics with minimum time and effort. With access to more and frequent data, healthcare providers now have a more comprehensive profile of patients for better diagnosis and timely intervention. Since the data is shared seamlessly, our doctors can even treat patients remotely. Patients are saved the pain and the cost of repeated blood extraction, as the system will automatically suggest to staff that a repeat blood test can be done on a blood sample that has been taken earlier. And this has cut the number of blood extractions by more than 1,000 every month. And this translates to savings for about 21,000 for patients. Now, we also have included the elimination to have to print out our ECG reports, and this has saved the hospitals substantial amount of expenditure. Patients of today take a very proactive approach to healthcare and typically will seek medical advice and second opinions across doctors and hospitals in Singapore. With the electronic medical record system, which is accessible across multiple healthcare providers, it cuts down on duplicate medical testing, which then saves time and costs for the patient. These shared digital databases are extremely useful in emergency situations where a patient may be unconscious. So, the ability to assess the patient's medical history quickly allows the healthcare professionals to administer appropriate treatment and care in a timely manner. With our success with the electronic medical records, this has eventually led to the adoption at a national level, with the deployment of the system to both the private and the public health institution across Singapore to support the one patient, one health record. It is understandable that we have concerns about security and privacy of confidential patient information. But where technology presents challenges, it also presents opportunities. I'm now going to draw on something which is very key to us in clinical practice: patient safety. This is a key priority in healthcare, and no hospital encounters is devoid of medication administration. Healthcare organizations have long been dependent on the vigilance of nurses to identify and intercept medication errors before they can adversely affect patients. In practice, an error can occur at any one of the four different stages of the medication process, namely while prescribing or processing, dispensing, or administering the medication. As a consequence of medication error, a patient may receive inappropriate medication, the wrong dose of medicine that is intended for another patient. So, medication may also be administered, for example, at the wrong time. In the worst case, erroneous medication can result in the patient's death. We recognize there is a need to leverage on technology to reduce medications error and have adopted the closed loop medication system. This system is actually a revolutionary process. It integrates automated and the intelligent system to completely close the inpatient medication management and administration loop. The components include: we begin with the doctor prescribing the medication into the system. It is done electronically. Pharmacists will verify the medication order, and then they proceed with the packaging and barcoding of the tablets and the capsules. The packed and barcoded tablets are then sent to the respective wards. Secured medication is then put into the ward system. We then proceed with bedside scanning before the medication is safely administered to the patient. As you can see, what is the value that has been added is it improves patient safety through the reducing medication errors. We remove wastage. There is improvement in efficiency because there's reduction turnaround time of the medication stock. Many times in the hospital, we do have urgent medication and stat orders, which is on time, on demand serving. So, with this process, there is prompt issue from the pharmacy department. And last but not least, it improves our billing process. As an educator, I would also like to bring on board that clinical care is not limited to patient care. More often, our nurses would have to play a key role of clinical preceptors and educators for junior nurses and nursing students. It cannot be contested that the trained nurse preceptor's level of competency will impact the junior and nursing students' learning experience and clinical competence. But preceptors are often challenged because they have to manage dual roles. Higher priority, however, is usually given to the clinical duties as opposed to their precepting roles. And the literature supports that the role ambiguity is more profound in preceptors who lack adequate preparation in pedagogical education and assessment. To overcome this, working in collaboration with the healthcare institution, a colleague and I at the National University of Singapore, together with colleagues from the institution, we developed a web based program to enhance the nurse preceptors' teaching competency. We developed 8 modules to be included in the web-based program, and the modules were that we developed focus on preceptorship, how you can plan care with your preceptee, conducting clinical assessment, facilitating the clinical learning, creating a positive clinical learning environment, providing constructive feedback, handling challenging situations, and managing underperforming nursing students or preceptees. The program has been successfully utilized for nursing professional development in the clinical settings, and it also offers a more flexible, self regulated measure of learning, thereby minimizing the impact of the learners, and they were able to balance between their work at the same time having to attend this web-based program. The digital transformation is not an easy journey, and we are very mindful that it takes a lot to support during this entire transformation. So, how did we do it back home? New skills were required for nurses to be effective and efficient to function adequately in the digital realm. They need to learn not only to navigate the use of the technology, but how to use the data and the information. The training was deemed essential, and there was a need to dedicate time for nurses to attend the training because training cannot be achieved when the nurse has to meet patient needs. Similarly, when technology can be an enabler and has the potential to improve the decision making and care delivery process, there was also a need to exercise caution that the nurses are not overloaded with the digital technology. Otherwise, the adoption process will be very complicated and fraught with more challenges. Nurses should not be expected to input too many variables into the system or respond to multiple alarms. Then none of it becomes a priority or relevant to care. There's a term called alarm fatigue, and this is a problem in a fully digitalized environment that is amplified. There has to be a right balance between nursing notification that support the harm reduction and error prevention. But nevertheless, we agree and acknowledge that alarm fatigue is also difficult to achieve. Measures were taken to integrate the change in the work process gradually. A key consideration that we had to take on board was the current nursing workforce constitutes a multi generation group with different skill mix, attitudes, and values. Staff were given time to assimilate the change using achievable time frames. This is very evident when you have learners who span from the baby boomer era to the Gen X population. Support that continued was throughout the entire adoption process. It remained critical to remember that nursing is and will always remain uniquely as a human profession with a central focus on caring. Nurses should not be detracted from the core values and responsibilities, the humanistic caring aspect. So, technology, we argue, can never replace the human touch. Just as technology has permeated everyone's life, it is important for nurse leaders to understand the perspective of the nurses and the patients regarding the impact of technology in care delivery. Meeting patients' spiritual, psychological, and social needs cannot be appropriately met in a digital space. No matter how advanced or precise technology can be, it is imperative that the patient remains the central focus of care delivery. This brings me to the end of my sharing, and I really like to extend my appreciation to the organizers for giving me this opportunity. Thank you.
Thank you, ma'am. It was a provocative session that made everyone mesmerized towards your speech. The thought that you have given that support during the digital transformation is an excellent word that you have mentioned, that how it helps us, the nurses, during the transformation in the digital era. About you, what you said, that's training new skills and the dedicated time and mindful and multi-general challenges. These are the challenges, these are the points that each and every nursing students and faculty will take up, and it will help them to grow in this digital era. Thank you so much, ma'am.
Thank you.
Thanks. And if any questions? Thank you so much, ma'am, for your valuable time you have spent towards us. It's our pleasure to have you, ma'am. Thank you, ma'am.
Thank you very much. And I'll take my leave now.
Yes, ma'am. Yeah, yeah. Thank you.
Thank you. Have a great conference.
Okay, thank you, ma'am. Yeah, yeah, yeah. Okay. We'll go to the next session on digitalization and nursing research. Here comes Dr. Nageshwar Venkatesh Reddy, Assistant Professor, Nursing Department, Faculty of Applied Medical Sciences, Al-Baha University, Ministry of Higher Education, and Kingdom of Saudi Arabia. He has completed his basic BSc Nursing from Government College of Nursing Fort Bangalore and MSc Psychiatric Nursing, Father Muller College of Nursing, Kankanadi, Mangalore. And he has completed his PhD from Manipal University, Manipal College of Nursing, Karnataka. He is being an instructor in BLS and ACLS from American Heart Association, and also certified in pain management course, and with that extend to biostatics and research methodology. Is an external foreign PhD thesis evaluator for various universities, and is an approved PhD guide from UGC from year 2018. He's a statistics consultant for a dental, nursing, and many engineering institutes. And he is so expertised in using SPSS data analysis and interpretation of data. He has published numerous numbers of paper and presented various papers in the conferences. I am delighted to embrace Dr. Nageshwar Venkatesh Reddy sir to go ahead with this session.
Thank you very much for the introduction. I'm happy being here, and it's my pleasure to be associated with Subharti University and Subharti Nursing College as well. So without taking much of the time, I will be sharing my screen now.
Yeah, sure, sir.
I hope my voice is audible and my screen is visible, right?
Yes, it is audible and your screen is visible.
Yeah, thank you very much. I thank the organizing committee for giving me this opportunity to have this session in International Virtual Conference, which is Amelioration in Education, Research and Clinical Practice, focusing on e-digital health, e-digital native era. So the topic allotted for me is digitalization and nursing research. And as you have already got an introduction from the host, myself, Dr. Nageshwar V. Reddy, I am working as an assistant professor in Al-Baha University, Ministry of Higher Education, can I say? It's been here so far 2 years. I'm working here. It's a new experience for me, and it's a good place. Not as such you are thinking. You can see all the Gulf countries will be always having very high summer temperature, but I am located in a place where it is very cold. That's why you can see me. I'm wearing trousers. So this is my a brief introduction about this. So the topic towards allotted for me about on this conference is digitalization and nursing research. So this is the session plan. Now we have a lot of technological advancements, which we will discuss. What are all the technological advancements are happening, and digital technology in nursing also. Digital technology in nursing also is nowhere lagging behind, because you might have heard there are quite a lot of people who are from 20 or 2 or 3 decades before. They were not much advanced in digital technology, and probably you might have heard there are many people even today also they are not much oriented with the technology. And we used to hear when we are in colleges around 2000 or 2005, uh, people never used to adjust for the digital technology. They used to say that traditional things are far better. I agree with the fact that traditional things are far better, but you know the kind of advancements which have happened last decade, it is about 10 years before how we were and how we are today, it is entirely different. And those people who have not adopted this technology are out of the profession, are almost they are sitting at the cornerstone of the profession. Now can you imagine in future, maybe another 10 years, where we will be standing in the technological advancements? So that's what I wanted to give an introduction here. Of course, indeed, we are when we are talking about advanced technology, there are challenges also as well. There are those challenges also we will be discussing as uh, best as our best. Now, what are the kind of technological advancements you can see now? There is a digital technology transformation in the society. Now, once upon a time, we used to send mails, the post and courier. It used to take few weeks or few months to reach a different part of the. Forget about world. Even in India, we used to send mails, which used to reach maybe after a few weeks. And today, the advancement is so vast that within fraction of a seconds, you will get to know about the information which is happening in the different part of the world. And that's how we have developed a COVID vaccine today. Otherwise, you could have imagined to develop a vaccine, it takes minimum of 2.5 to 3 years. And with the kind of advancements we are receiving from the different part of the world, it is a digital technology which has transformed our lives. So be very careful in upgrading our digital technology. Forget about 10 years, just 5 years before. If you talk about 5 years before, we were not having internet facilities. And we never used to have a lot of internet on our fingertips, right? So generally speaking, this is the much of digital technology which is transformed in our society. What about healthcare system? Now, healthcare system is also one of the important areas where we have adopted the technology. What are all the technology we have adopted? Now, we used to check the blood pressure using sphygmomanometer. But now the digital technology is giving you accurate measurement of BP. Yesterday, I was watching one video. There is a new apparatus which will be used by the doctors in place of stethoscope, which will indeed scan all the body parts. And it is worth of X-ray machine, ultrasound scanning machine, right? And there are quite a lot of advantages which you have, and the cost is very minimal. And you might have seen there are many people who have introduced very small ECG machines with ECG app. With that kind of extensive digitalization in the last decade, can you imagine if you don't upgrade yourself, you are going to survive in the profession? So for me, you have to adapt to the digitalization. And that is where your much of the interest is existed for the future of our profession. Now, everything is emphasizing on patient care. Of course, today we are all giving patient-centered care. Whatever you are deciding, you have to informing to the patient as well, and we will be taking decisions based on the patient's consent. Now, telemedicine is one of the biggest achievement, especially during the time of pandemic. There are quite a lot of people who have suffered for the face-to-face consultation. Now, the telemedicine has introduced long before, but we were having a lot of pitfalls in India to get to know about this. And last year, I've seen quite a lot of corporate hospitals and even some government setups have used the telemedicine for the purpose of the benefit of the patient. And now you can see there are many mobile apps are available. For each and everything, there are mobile apps to track your heart rate, to track your pulse, to track your respiration, to track your movements, to track your, how much healthy activity you are having in a week, in a day, in a minutes, how much you are doing your exercise. And it will also remind you that you are lagging behind or you are doing good. Such an advancement we have at our fingertips. And there are a lot of knowledge resources which we have. The knowledge resources what we have are that extent that we could not read any of these things completely. Do you imagine? Once upon a time, if you wanted to read something, you have to go to the library. Or if you don't have a library access, you have to purchase a book at least by paying some money. But today, there are quite a lot of resources which are available on internet, which are free of cost. And what we are doing? We are just downloading and keeping it on our hard disk. We never read this. This is one of the factor which is the hindrance of technology. We keep saving many of the things in our computer which is of no use when we are not reading. Including me, there are quite a lot of things I have saved in my computer, but there is no time for reading this. And nowhere, it's not only nursing practice, it is education, right? It is research, including it is administration. Everywhere there is an advancement. And those students who are from the PG background, now who are doing PG, there is a suggestion for you. Please do upgrade your technical skills, digitalization skills. Now, if you're studying PG, this is the time where you have to upgrade your skills. Don't aim for scoring more marks. Aim for developing the skills, upgrading the skills according to the current developments. And the credit goes to nurse researchers as well. Of course, I am a researcher also. And all these developments are because of nurse researchers. Now, whatever you are reading today, everything is because of research. Now, have you ever imagined that research will take you to that extent where today, without research, you cannot have any kind of advancements? Indeed, there are 95% of the researches are not applied. Why? Because they are not evidence based. And whatever the 5% are there, if you wanted to get into this 5%, 95% you have to succeed. And you take, it's not only about research, you take about any profession, 95% of the people in any profession are of no use. Only 5% will sit in that category where they will be serving all these 95% plus. And the same applies to researcher also. So these are all the technological advancements which we have today. And with the kind of these technological advancements what we have, can you imagine if we are sitting at a chair at a corner of one room and we are saying that no, we don't know technology, we don't want to adapt to the technology? Can we imagine we will survive in the future? We never. I don't know what will happen in next 1 year. I don't know what will happen in next 1 month. What advancement will come? What we have to adopt? Now you are doing a lot of nursing educational activities. You have never imagined 20 years before they were never used to have this much of technological advancements in nursing education. We used to prepare PPT. We used to have a lot of videos for the discussion. Today what we are doing international conference, it is because of virtual YouTube live. And it is not possible to do such kind of things. I am sitting here in my uh, workplace and I am doing this. So this is a kind of a technological advancement world we are living in. So I suggest each and everyone who are listening to this conference to technically upgrade all the skills. Now, if you don't upgrade all the skills, honestly speaking, you will be out of the profession in next 1 decade, probably next 5 years also. Let us move on to the next slide. Of course, we have a training, which is a challenging aspect. Now, there are many people out there who are waiting for the training. But I'll tell you one thing, training will satisfy your mind, but your skill you will develop only when you do on your own. You may attend a lot of conferences, workshops like this, but if you don't put these things into the practice, it's of no use. And there may be many people while doing PhD, PG, and BSc nursing, they will be using all these technological advancements while they are in the institution, while they are studying it. But what happens if they don't study? Now, it is happening all over the world. Once we stop our studies, unfortunately, we stop our growth. We will work for the salary. We will work for the satisfaction. I remember one quote saying that you should be always having one risk at your place. If you don't have a risk, you don't think critically. If you don't have a risk, you don't learn anything. Now, say for example, you got into a government job which is fetching you a salary of 50K per month. You should not be satisfied there. You should upgrade your skills. For that, you need to join some courses by paying some high fees, because high fees will motivate us to listen. So that's why when we are in institution level, we are aiming to come out of the institution without having any problem. For that, we have paid so much of money, so we wanted to study. That's what smart people will do. They use creativity and technology together. Now, if you think using a PowerPoint presentation today is a risk for you, you may not be able to learn this anytime. Now, always remember, there is no success in your life, not even my life. Success means to learn new things that you will learn only when you take a risk. If there is an exam, you will study. If there are marks, you will study. So if you wanted to learn something, put yourself in some place of risk. If there is no risk, there is no learning, there is no creativity. Now, if you can do this, whatever I can say, like a retrospective evaluation of your life. Now, whenever you are at risk, whenever the teacher is strict, whenever the college is very strict, whenever you are at risk, whenever you consider teachers are bad, you have learned more. Whenever you are comfortable, whenever teachers are very good, whenever you feel you are in more soothing place, you don't have anything to think, you will sleep nicely and you are not going to learn anything. So that's what the creativity will enhance your from the smart people will enhance the creativity with the technology. So these are all the kind of technological advancements which are in general which is happening. Now let us come to digital technology in nursing research. Now I don't know whether I can speak about digital technology in nursing research in this span of maybe 1 hour, because there is quite a lot of information which is available about digital technology in nursing. So what I wanted to say you here is nursing research is future of a profession. Now you go to anywhere in the world, for your growth and development they will ask how many number of publications you have. Now how do you publish? There is something called H index. There is something called Scopus indexed journals, Web of Science indexed journals, right? So these indexed journals are having more weightage. Now, if you have to publish here, you have to be at least pro expert in nursing research. Now, the digital libraries and computers and online databases, which we have in all the part of the world, in each and every college, of course, in each and every nursing institute, how many of you gone there and touched these computers and searched the databases for the research articles and what is going on, or at least those who are nurses who are working in the hospital, you will have a digital library. How many of you have gone there to check for evidence available for whatever the problems you're facing in the hospital? And these are all the databases: Sinhal, PubMed, Sage, ProQuest, Elsevier, Springler Link, Scopus, EBSCOhost. And CINAHL is one of the nursing health allied literature, cumulative index of nursing and health allied literature. We have an access to our fingertips. When I was doing my PG, I was not having these things at my fingertips. I used to go for doing manual search in different parts of the state, including sometimes I had been to Niman, sometimes I had been to Manipal. We went there. But today you have everything in your hand. We have to review, we had to retrieve, and we have to utilize these things. So these are all digital libraries which are there in your hand. Now, there are so many courses for each and every database. They have YouTube tutorials to how to use this. Remember, don't simply do Google search and come to an article, come to a conclusion that there is an evidence exists. Google will give what you want, not what is needed. Now, if you think nursing research is not good, Google will say nursing research is not good. Now, if you think nursing research is good, Google will say nursing research is good. So, Google is not an ultimate search engine for academic researchers, including Google Scholar I'm talking about. Simply don't Google and get out one article and get it. Please do search in standard databases. Sit, read, retrieve. After reading, see, it's not that one time you read, you understood everything. Every time you read one nursing research, which is published in standard journals, you will get new insights. That is called as retrieving again and again. Then utilize it. Now, there are many students and guides out there who will be designing the nursing research methodology sitting in one corner of the room, but it is not so. You have to design using the literature. The best guide available for you is literature, and that is available in standard database. Now, the more you read the literature, the best research expert you'll become. And this is how you use digital libraries. Each and every article you get from digital library, sit, read, retrieve, and then utilize it based on your experience in your setting. And you need a guide only for the purpose of to say whether this can be accepted in that particular setting or not. Since you are doing first time research in setting in the new setting where you are doing PG, so your guide have a lot of experience in that particular hospital or a college, so they will tell you whether it is possible or not. Otherwise, you have to go few kilometers traveling to get the such type of literatures. We literally had been all these challenges, but today we have everything, but we are not doing. Now, you know what? That time we were having a risk of going away and getting the things done. That's why we have done it. But today you have a comfort of everything downloading at your workplace. That's why nobody is doing. It's not, I'm not telling about you only, including me. I download quite a lot of things, but I don't have a time to read this. But those people who have a time, even today, I feel very much low because I don't have time to read a lot of things. There are quite a lot of things which are available online. We have to be selective. There is an information explosion all over the world. For one topic, there are quite a lot of controversies are happening. Now you should sit. If you wanted to really learn, you should sit and talk about. And the second most important place where we use digital technology is subject recruitment. I suggest all the guides and students to use the subject recruitment digital technology in your researches hereafter. I have seen many of the guides who are rigid in traditional researchers who will go in person only to collect the data. But digital technology has given you a lot of advantage of preparing the questionnaires on Google Forms and send it to different part of the world. Indeed, even if you give a form physically, you don't know whether they are going to fill it up right or not. So there are quite a lot of research methodologies to be employed to make sure that whether they are understanding and filling up the forms which are very much near to your expectations. And the subject recruitment is a challenge for the researchers. Because subject recruitment, you start from sampling frame and population, and you will also find out the sampling size, and you see whether this sampling size is available in that particular setting where you are doing the research. But for all these things, you have to go to the setting. But there is something called a setting website. Now, if you're doing a hospital-based service, there is a website for that. If you know how to use the technology, you will get to know everything. How many number of patients are coming in a week, in a month? How many number of patients are getting admitted? Or OPD, follow-up? What is the registry? They have an online registry. How do they track? It is not necessary for us to each and every time to search one patient in the list. If you have a computer, you can just control F and search a patient name. Immediately you will get it. You can concentrate on your research. You have all the data which is filled up in Google form and which is saved in Google. It is not necessary for you to take all these things all the way from different part of your college to the different part of your setting, because Google is there everywhere. You open with your email and password, you will get your Google Forms. And why do you want to carry all these papers, laptop, everything? Now, in fact, we are doing even online attendance also we are not taking, because when we are doing the lectures, when we are doing the classes, automatically the online attendance will be taken. Whoever is joining late, it will show. Whoever is joining. Now, I will give you I can give an option that anybody is joining after 15 or 20 minutes, they will be considered as absent. So I don't have a burden in taking an attendance, because whereas I have to concentrate on my professional knowledge encountering. So you will have a list of all of your population. Now, when you're doing especially experimental studies of a different type of what I can say, different intervals, you will be collecting the data. You don't need to search each and every time about the previous patient. You can have a registry online. This is very easy. Now one more thing I'll tell you. Every research is happening in the world which will make things for you at ease. It is not making things complicated. It is making you ease. Now, any development is coming into the world which will make you things easier. But problem is, we don't want to learn it. We have an attitude of rigidity. I always say to many of the students and my colleagues, we should have an attitude of a children, because each and every time they cry and they forget. They don't have any stress. They learn things faster because they don't have a rigidity in their mind. We should have a rigidity. We should not have rigidity. We should adopt unlearning skills which we have learned earlier, and we should learn new skills, and we should be fast enough. I cannot say I have a lot of library in my home which is of no use, which is outdated. Now new editions are coming. So that's how you can maintain a subject recruitment also. Now the next move on to data collection and analysis. Now when you're talking about data collection and analysis, you will have your plan. You can have prepare a Google Forms, and you can send a Google Forms for data validation also. And there comes one more challenge you will have, because those people who do data validation, they expect you to send physical copy, because they don't want to download and check online and send it. Of course, there are quite a number of experts are there who are not digitalized. Sometimes we have to accept the fact. But hopefully in future, if you become an expert, nobody should feel bad to send you a Google form for the validation. You should, when you have experienced such a challenges, you make sure that your students, further your next generation, will not have such kind of challenges. Now, what I wanted to say here is, I'm not telling you don't send to those people who are not digitalized, because they also have stuff. They know a lot of things. Their experience matters a lot. And you use email, social media, Skype, telephone, and telemedicine for collecting the data. Why can't you use? Now, most of the times we use Skype and other social media for entertainment purposes. But why can't we use for our research also? Now, what I wanted to say you here again is that social media is not only about entertainment media, about Facebook and WhatsApp. Now, we have a LinkedIn, right? We have a LinkedIn, which is professional connections. We have a research gate, which are having professional connections. All these things can be used for your nursing research. And nursing informatics, which is created a pathway between practitioners and researchers. Because whenever we do research, we do collect the data from the practitioners where what they want, we wanted to know. Now, you do a lot of research which is of no use anywhere in any of the field. It's of no use, right? So informatics is very important, which is connecting between practitioners, researchers, educationists, and indeed administrators also. Now, there is one more thing. The mobile apps, which I have already discussed, related to clinical trials. Now, whenever you do clinical trials, you will need to have a registry of following up of all the patients. What is happening? What are the side effects that have happened? Any problem? How to overcome those things? If anybody is asking you in mobile app itself, we will ask the patients to install the app and report if there is any problem. So you'll come to know here itself. You don't need to wait till the time of the follow-up. Now, gone are those days when we used to have, we used to carry a community bag. You remember community bag, and we used to test using a test tube about HB and glucose estimation, all those things. But now it's very easy and accurate. All those earlier procedures you used to do, they are approximation. They are not accurate. Now today we are doing a digital estimation of HB and glucose. Why? How? Because the nursing developments have happened. Researchers have come forward and they told this is more accurate and they are cost effective also. And anybody can keep these things at home and they can test it. And you can have a sample mortality, attrition rate can be reduced. You can reduce your burden. Whenever you recruit a sample, there is a possibility that you may not get the sample. Sometimes they may not be accessible. They may be going to some other places. So when you have an accessibility over internet, you will be directly sending them a WhatsApp message or a Facebook or even mobile app related, even email also you can send. So they will get a notification and they will report it to you. And attrition rate, there are many of the times sample itself is not available. Sample mortality is like after recruiting you are going to lose some patients, but attrition rate, there are dropouts in between. Sample mortality, you are not getting the sample. Attrition rate, there are dropouts in between after recruiting. That can be reduced by this, by calling them, by sending emails, by sending frequent reminders. It will increase the access to the population. You don't need to wait. Like, for example, you wanted to collect a data from Delhi, you don't need to travel to Delhi. You can just send a message. You can just send a reminder, and after that, if you are not getting, you can even give a call. Today all calls are free. And if you wanted to find out an existing evidence from the new perspective, for example, you have done a research. When you have done a research, you wanted to find out a new perspective from the existing evidence. What is already present and what you have found. For that, you need to have a lot of articles with you. How do you get those things? Online. You will download it and you will see whether existing evidence is having same or different. And if it is different, what is the problem in your research? If there is no problem, and maybe there is in your area, the outcome itself is like that in your field. And there may be many of the people, you may be knowing that you have to collect the articles and you have to write whatever the style of writing the referencing styles, we call it as maybe sometimes APA, maybe Vancouver style. Every time it's a so much hectic job. Instead of doing research and concentrating on the research, there is a lot of problem inside your mind about the format. Now, there are many softwares are available. Simply if you download an article there, they will automatically store in whatever the referencing style you wanted to store. And you believe it or not, there are softwares available to write the thesis today. If you just keep on writing the thesis, whatever the style you wanted to give, it will automatically have the format of that style. You don't need to manually type, because there are manual errors are many. When you give it to the software, the thesis will automatically write in whatever the style you wanted it to write. But we are in the old age of opening Microsoft Word and typing the things. And even if you copy paste, there is something called plagiarism which will come into picture now. Now you have to type the things. You have to make sure all the formats are right, referencing style, language, everything is very important. And when the moment you started to concentrate on all these aspects, you forget about the quality of the research you're doing it. We have all these things in hand. I'm telling you, we have all these things at your fingertips. Only thing is you need to put an efforts to study. If you study, if you develop a skill, for your lifetime it is useful. Simply download all the data, keep it in these softwares, and whenever you want, you can retrieve it. Automatically, you are retrieving data. Reference will go to your references, and whatever the style you are writing, there after that sentence, that referencing style will automatically will come. You don't need to place a full stop, open the brackets, or maybe you will need to have a superscript after full stop. All these things, no headache. This is a referencing. But what about SPSS and R software? Now, many of you are aware about statistics, right? You may be doing a lot of statistics, and sometimes you go to statisticians for getting the research things done. You will consider statisticians are the god of research, and whatever they say, you follow it. Then why you are called as researcher? Statisticians will give you only a concept, only an idea. Don't consider everything from the statistician. You also have your own knowledge in developing the skills to conclude your research. Now, I'll give you an example. Just because it is statistically significant, because whatever the data you have given in SPSS, that output will come. It doesn't mean your research is completely failed. And just because it is not statistically significant, it doesn't mean that your research is completely right. Because you have clinical significant difference. And I don't entertain anybody to do manual calculations, because manual calculations will have lot of errors. And these errors, to evaluate these errors will take a lot of time again. We are not into that generation where we cross check each and everything, because you get something, I have to cross check it whether you have done it right or not. Again, it will take a lot of time for me. But SPSS, in a matter of seconds you will get it. In a matter of minutes you can do everything. Only thing is data have to be accurately written. Even if data is accurately not written, that also can be evaluated. But when you do manually, you don't know the data is right or not. So we have something at our handy. And being a statistician, I'll tell you, I'm a biomedical statistician. Being a statistician, I'll tell you, statistics is not as tough as you are thinking. It only need a lot of experience for you to understand what type of statistics have to be applied in which place. You don't need to go to the statistician always, unless it is very higher research, maybe at the level of PhD or funded researchers. You don't need to go to statistician and pay a lot of money. I say many of the times, don't go to statistician. Learn yourself. Tomorrow you are going to lead some students. And for every student you are telling you go to a statistician. And I'm sorry if there are any statisticians. I'm not denying the fact that your expertise is not of no use. You have an expertise. But we also have to learn. Being a nurses, it is our responsibility to know about the statistics and to know about the research also. And research methodology will be guided by guide, and statistics will be guided by statistician. Then what we are doing? Remember these things. We have everything in your hand. Sometimes you can do Google search and find out the answer. And with that answer, you can use it in the database and you see whether authenticity is there or not. Evidence is there or not. For the evidence, you can use Cochrane library. And if you wanted some of the softwares, many of the softwares are freely available. Free trial you can use. And Railman software is a software which is a review manager, which you can download all the data and keep it inside, where whenever you want it, you can retrieve it from there. And all these databases have inbuilt a lot of mechanisms. If you create a username and software, you can save your search. You can save your search strategies. There are something called as search strategies. How to search in one particular database. You can go to the database wherever you wanted to do it, especially Scopus and Web of Science. There are some tutorials. Please go through those tutorials. Once in a lifetime, if you learn, you will be expert in digital technology. That is what it is about data collection and analysis. Now, when you move on to communication and dissemination, we have Google Scholar, we have a lot of databases, social media, ResearchGate, LinkedIn, email, research summaries. All these databases serve as useful communication routes for the researchers to publish evidence and also practitioners to analyze and use the evidence. Now, you can use any communication media to disseminate the knowledge. It is not necessary that you go to one physical journal and they accept it. If nobody is accepting, you can even have a research summaries. You can go to the some of the conferences and you can present your research. Now, why do you present your research? You present your research only for the purpose of coming to a conclusion that you will get a lot of inputs from others. It is not for the purpose of getting the award. You may get a lot of inputs. For that is the reason you will be doing this communication and dissemination. Out there are quite a lot of researches are not published. Most of the people, they do till analysis, they do prepare thesis, and they do keep this thesis in the university libraries. But they are not going to publish this. They'll not be publishing this. So what to do when they are not able to publish? The basic idea of doing research is what? To communicate and disseminate. When you do a research, it has to be communicated to the world. And when you do this much of research, if you are not communicating, it is like one very good, resourceful textbook which is there in the library and nobody is reading it. It's like this. Your knowledge, you have a lot of knowledge. If somebody is not disseminating the knowledge, what is the use of knowledge? Now, you are a nurse. If you are not doing nursing, what is the use of nursing? I say many of the times, some people after doing MSc, after doing BSc, they go for MBA. Now, for the purpose of doing MBA, why you have gone to BSc nursing? You wanted to change after knowing that. Now, who knows? After doing MBA also, you may change your profession. So do something. What is the goal? Actual goal is there. Now, after doing MBA, people will come back to do MSc nursing again. Now, I have not done any of the courses like that. But once you do MSc, once you do PhD, then after that, if you do have something to do like MBA or some of the other courses, you can do it. There is no problem. But if you wanted to achieve excellence, you have to reach till the end of the process. That is communication and dissemination. It is easy nowadays. You search some online journals, you see whether what is the H index they have, and you provide it, and you follow up. If there is a good journal, it will take another 6 months or 1 year to publish. That will add to your CV. Now, the research is the only place your growth is estimated based on your experience also. Just because you have 10-15 years of experience, if you don't have any credit of articles to your CV, you don't have any use of experience. 10 years before, people used to consider 15 years, 20 years experience we want. But tomorrow, I think future is going to come. They expect at least some 5 articles to be published in Scopus Index Journal. Then only you will be promoted. Already it is there in government settings. Since it is not much visible, we are not aware of these things. Now, what are all the challenges we have? We discussed about what are all the benefits which are available. But what are all the challenges? Of course, for every good thing, there is something which is a challenge. Now, you may ask a question, Doctor, you're saying a lot of things about learning, from where we should learn. Because many of the research experts, many of the experts in the profession are having lack of digital literacy. We call it as digital literacy. Earlier, literacy was there. When you study ABCD, when you wanted to know sign, if you sign, then that is you are called as literate. But now today, if you know how to operate a computer and how to use the technology, then that is called as digital literacy. Maybe I can say very handful of the people are having digital literacy. They have a lot of knowledge, they have a lot of experience, but digital literacy, when it comes, they don't want to unlearn the previous things. They don't want to learn new things because of the rigidity. And there is one more funny thing, perception, thinking that the world won't change. That's why you are also not going to change. Remember, world is always changing. World will always change, and we always resist change. Now, how much ever you resist change, world will not stop. It will keep changing. Definitely, it will keep changing. You may not see change in front of you, but after 10 years, you will think, oh, I would have learned long before. Now it is not the time. So before that, adapt to the changes. Changes are happening in the world. World is moving very fast. And if you think that everything will come on your table where you are sitting, wrong. You have to work on it. You have to develop your skills. Every day is a new challenge in technology, Daily things are getting updated. Daily apps, your mobile apps are getting updated. It means what? Every day new things are coming. And if you are not adopting every day new things, then how you are going to survive in the future? You may be thinking, sir, there are many things earlier, many people have survived without learning anything. See, earlier things are different. Now things are different. The advancements which are happened in last 20 years have not happened till the evolution of the man. Now, when the man have started to live in this world till 2000 AD, the evolutions are not happened. That much evolutions are happened in last 20 years. And can you imagine next 5 years where you will be? So learn faster. Today, spend your lot of time in learning things. Allot some time daily in learning new things. And the third one is institutional support. There may be very good students, there may be very good faculty. Sometimes institution will not have an access to the digital library because nobody wants it. Now, I can see there are many of the university wanted to subscribe it, but if nobody wants to use it, what is the use of subscription? The subscription is of few lakhs. Now, when you don't use it, or when you don't request the management, how do they take the subscription? And when it is asked, people say, no, we don't have time to do all those things. Now, if you don't have time to do all those things tomorrow, time will replace you, a person who is expertise in that place. I know you think that you will use validity of the technology. Some people will be using still old mobile phones which are not having any uh, update features. Now, some people are even using some, not even using the Android or maybe Mac phones. Now, what is the use of using such phones today? Only receiving the calls and calling. But today we want many things at your fingertips. Now, if you don't upgrade yourself to your Android technology, which is getting latest updates, not for the purpose of entertainment and communication, at least for the purpose of your academic improvements, then again you will be lost. Sometimes there will be regulatory bodies, barriers from the laws of the government, which whereas we don't have as such, because Indian government and UGC is doing much to facilitate a lot of things for our communication in India. Now, what to conclude with all these things? We have a challenges, right? We have advantages, but the technology is for the benefit only. Remember, technology is not creating any disaster for you. Now, how do you use it matters. Now, every country have nuclear bomb with them. It is not to destroy others. Why? It is only to inform the world that we are powerful enough. If somebody is invading, we are also powerful enough. So, like that, technology, if you wanted, if you know, you will use it is a powerful future. But if you take it that advantage to make that illegal way of making money, then it's of disaster for you. No one is aware of future. No, no one is aware of future. The only way to adopt future is changing according to the trend. Now, whatever the trend is there, you have to adopt and go according to the trend. Technology is boon for everyone if used optimally and appropriately. Exactly what it is supposed to use, you have to use it. It is not that today I spoke, today you learned everything, and tomorrow onwards you will implement. It takes at least 5 to 10 years to learn everything for you. And by that time, things things have changed. But at least you keep learning, you keep adopting to the change. Because today you start learning, tomorrow things will update. And that update, along with that update, you are going to learn. Despite of which many of the advantages, many are misusing it and abusing it. Now I say there are many people out there in DTP centers who knows how to type the thesis. And those people who are not interested to do in something here, they will go to a DTP center and get thesis done and submit to the college and get the degree. What is the use of it? It is like you are seeing some surgery in the YouTube and going and doing the surgery. It's not that, right? You need to develop a skill. Now, for that skill to be developed, you need at least 5 to 10 years. As like in addiction, if you're getting very good money out of this misusing of the technology, you will keep using all these things always and you'll get addicted to it. And you don't learn anything. Only it's like, there is no difference between you and a computer. Computer also will do whatever the commands it is giving and whatever the commands, because we bought it for the money. And you will also get money whatever you are doing, for whatever the things you are doing. Developing skill is an art. Nursing is an art. It's a skill. We have to develop the art. We need time and patience. We need to be patient and time to master it. We need to have time and patience to master it. Any art, it will not come very easily for you. Remember, there is no free lunch. Now I'll tell you one big fact here. If anybody is giving any offer for you, it may be online, it may be offline, anywhere. They are not offering you for your benefits. They are offering you for their benefits. There's a small story I wanted to tell you. One person was selling a coconut. Every coconut costs, one coconut cost 5 rupees. Remember, okay, let me give a reality. One coconut costs 20 rupees. Right? And 3 coconuts, he says, 100 rupees. Now I want only 1 coconut. But what I'll do, I'll go and I'll buy 3 coconuts. And I pay him each coconut wise 60 rupees. Why? Because each coconut costs 20. Now if I buy 3 coconuts together, I have to pay 100. Now I'd say I pay 60 only. Who is going to get benefit here? Me? No, because I want only 1, but I purchased 3. His knowledge or his intellectual skills made him to keep such a rate for 3 coconuts. But whereas I want only 1 and I purchased 3. He is not the loser. He is the one who is the gainer there, because he made me to buy 3 in place of 1. So like that, whenever you see the offers outside, you will buy it. Whether you want it or you don't want it, you don't know. Now here also, in many of the places, there are opportunities when you pay and learn. Whenever there is an opportunity to pay and learn, you should pay so that you have a risk, you will learn. And when you pay more, you have a lot of risk to learn it. Then you will learn it better. When something which is coming off very free or easily, you will not take much care. So with this, I am going to wind up my session with digitalization and nursing. These are all the references which I have used. So all these things, I think it is better you implement it. Whenever you implement it, it is better for you to have such kind of interaction. Otherwise, these conferences and workshops of not of any use. Now, with this, I'll thank organizers for giving me the opportunity to present this topic here.
Thank you, sir. It was an intriguing and fascinating carcass that you fed us with flavors of pondering on digitalization and research. There are some the few questions been asked by the participants.
Yeah, please.
The first question: shall we depend completely on technological advancement to do your nursing research without bias?
See, what I will tell you is, whenever the things are available at your hand, you can depend it. There is no problem. I can say these are all what actually what you wanted to depend on. There are many aspects in research, right?
Yeah.
What they wanted to depend on. They can ask directly if they can speak.
No, sir, they are not. They're just watching. They cannot be on live.
Okay. See, it depends on what type of adaptation they wanted to have. Not everything they can adopt in here. Not everything they can adopt. There are some places we can adopt. But I cannot say in general everything you can adopt to research, because you can sit in one corner of the room and you can do a research. It can happen only in what I can say, maybe evidence-based researches, where there are some group of people, and it also needs a lot of effort. It is not that everything, especially the epidemiological researches, you cannot do everything with only technology.
Yeah. Okay, sir. Thank you. And the next question is, what can nurses or student nurses do to stay relevant in healthcare on a technologically advanced future?
What can nurses or students, nurses,
Nurses do to stay
relevant?
relevant in healthcare on a technological advanced future?
They have to learn the things, everything, whatever is coming on their way.
Yeah.
And the best part of student nurses is if they wanted to adopt, they have to immediately after doing graduation, it is necessary for them to work in corporate hospitals at least for 1 or 2 years, so that they will be developing the new technological advancement skills. Because whatever we learn, especially in the university or in the government settings, we don't have that much of sophisticated setup to learn, and we may not be giving an opportunity to also to learn. Now when we go outside in corporate hospitals, especially, despite of the salary they offer, whether it is less or more, you need at least 1 to 2 years of experience there, so that advanced skills you are going to develop. So that is where we need to concentrate on, instead of becoming immediately coming to the teaching profession after your BSc nursing.
Okay, sir. Thank you. And then one more, last more.
Yeah.
Whether the growing adoption of artificial intelligence forced the nurses out of their job?
Never, never, never imagine that artificial intelligence will replace overall healthcare providers. Now we are dealing with the emotions. Artificial intelligence don't have emotions. Remember one thing: all over the world, the only much demanded profession is nursing. Now that nursing is same all over the world. It may be basic principles remain same. Now engineers can be replaced with softwares, artificial intelligence, because they don't need emotions there. But the doctors and the doctors and the nurses and all the healthcare providers, we need emotions. We need a very good communications. We need to satisfy the patients. Whereas artificial intelligence, we cannot satisfy. They cannot satisfy according to the moods and emotions of the patients. They can provide the care. See, I can come and I can provide, I can tell you, I can ask you what do you want, but the emotions and the touch, whatever the communication patterns which I use professionally, will not be replaced by artificial intelligence. Never imagine that nursing demand will come down in future, irrespective of any Google article you read. Nursing is at most demanded profession all over the world, in even before, today, and even future also, because it is the highest working force in the hospital, and hospitals are there all over the world. And you know about the patients are not going to reduce because of the technology and because of the food habits whatever we have today. Tomorrow patients will be increasing only, hospitals will be increasing only, people will be spending more money on hospitals, people will be spending a lot of things on the healthcare. That time more nurses are in need. So never artificial intelligence will replace nursing. It can reduce the burden, but if you are an expert in nursing, you will be always having a demand.
Yes, sir. And one more question.
Yeah.
Is digital libraries provide all the information needed for research?
Yes, it will provide, but we need subscription also. Just because we have digital library, it doesn't mean everything we can gain access, because very good databases are having quite a lot of accessibility charges. It's in few lakhs. And if more number of people demands your institution that you are in need of these things, everything everything is available in digital library. Plus, if you the latest advancements which would have not published, which will be there in the research gate, because most of the researchers are there in research gate. You can search in the research gate about the latest advancements, and you can directly have an accessibility, or you can think you can have a discussion with those people who are the authors of the particular research's direct accessibility. That is with the research gate. And for having that research gate ID also, you need to have an institutional email ID. For that also you have to demand. Now you see, many of the managements wanted to develop. They wanted to develop because future is development. When you develop, you will get good inputs. Now they wanted to develop, you have to request them to give an access to the digital libraries. So when you ask more, they will give. Now again, one more thing, when you ask, if you don't use, there is a track of how many people are using it in a year. Now if they found that nobody is using and it is used below average, again they are going to cut off the subscriptions. This I have seen in reputed universities also. In reputed digital libraries, reputed universities, they see entry book and exit book. How many people are coming into the library? How many people are utilizing the library? How many people are on the digital library also? How many people are getting an access? How many people are not getting an access? How much continuously these people are accessing? How these are useful in output of the research? Say, for example, 100 people have used, and how many articles have come out from the name of the institution. Now all these specific correlates will be correlated. It is not that only we are working in the institution. There are so many statisticians, so much of data they will be validating. Now we think we are the only people who are doing a lot of hard work, but hard work, it is not a property of anybody, right? It is the property of everyone. Those people who are doing hard work, other side management also, they will think a lot of things to pump in the funds. Now if they have to pump in the funds, they need to have something which is they are getting it back in terms of expertise, in terms of research articles. Now if we don't have all these things, again they will cut off the subscription. So that is the problem here. Now evidence, we mostly 99% of the academicians and nurses, nobody wants to do the research because there is no motivation. So for that we need to develop, we need to request, we need to progress, we need to again keep in touch with everything. Then it's a group, it's a group. It's not that one person I will do and everything will be there. No, it's a group. With the group you will get it.
Yes, thanks. And another one more question is coming. How can digital health technology system be implemented to enable health system?
This is, I think, something hypothetical. I don't understand exactly. How can digital health technology? What is digital? See, there are a lot of health digital technologies.
Yeah.
To enabling health system, it needs a group. It's a team. It's a management. It's an administration. Now you have some system. You have one technology which is evidence based. You can convince to the group. You can go and you can talk to the public. I mean, you can talk to the management that this system will reduce your burden. This system will help you in so and so, so and so. You carry out the pilot project. It's not that something which is some fruit which is there in the tree, you pluck it and you have it. It is not that. You need a lot of infrastructural complexities there. When there is an infrastructural complexities, you need to run a pilot project based on this. And with this, how much burden has been reduced, how much institution can save, what is the I can say any because technology is always comes with bugs. There are some fixes they have to do regularly. They have to update it. Is it possible? How much time it will take? How much resources we spend on it? With the same kind of returns they are getting or not. So there are different things which is not only health digital technology doesn't mean only one aspect or one part. There are a lot of things, right? So I can say it is transition, complete transition. So transition will not take place in one day. It takes maybe few weeks or few months or few years also sometimes. Right? Nowadays, people have adopted, mostly all over the world, people have adopted for online digital teaching. Earlier, nobody was aware. I feel so many people were not interested to do it. Now, even with or without interest, everybody have developed. So it has taken around 1 year for us to get it adopted. Now, sitting at one corner of my room, I can take. Earlier, people never used to take, and many of the experts used to reject because it is online. Now, there is no alternative. So it's like that health technology system. If it is needed, mandatory. If being a management, if I think yes, this is useful for me, I can use it, and the kind of money, time, and I am spending on this, it is giving me some satisfaction, and it is reducing the burden, and it is causing benefit for the patient. Definitely, you can enable it.
Yeah. Okay. Thanks. As the reply for thing you have asked, that is digital libraries provide all the information needed for research. So they have replied that. So for individual research, it will be expensive to buy digital libraries.
Yeah, it is very much expensive.
Okay.
It's very much. It's not possible. Even working in abroad, also, I could not afford that, because each and every article they charge, and
Okay.
we are not in that position to, unless you have funded researchers, we are not in
Okay.
that position to have an access.
Okay, sir. It's okay. It's fine, sir. Thanks for all your support and your answering to the questions. It's been so knowledgeable, and the time you have spent along with us from the day we contacted you until now. It's our pleasure to have you, sir. Thank you so much for your time, sir.
You're most welcome. Thank you very much for the host and organizer and organizing team, dean and principal and everybody. Thank you very much for giving me this opportunity. Thank you.
Okay. Thank you, sir. So it was a great and enthusiastic session we had about digitalization and nursing research. Hope you all enjoyed this class. To elaborate the theme of our conference, amelioration, I invite our principal ma'am to have the session now.
Jai Hind. First of all, my greetings to all honorable dignitaries, speakers who are the part of this international conference and bringing out such a knowledgeable deliberation with keeping our view of student centers objectives. I'm highly thankful to all the speakers and especially my previous speakers, Mr. Reddy, who has brought out a clear picture of what should be a nursing teacher now, with having a blended mode of learning style. Thank you so much. Now, why this theme and on the basis of what this theme was focused, let me have the narrative view of amelioration in nursing education, clinical practice, and nursing research with digitalization. Yes, as we know, the India is a global leader in information and communication technology and in other cutting-edge domains such as space. As per the National Education Policy 2020, the Digital India campaign is helping to transform the entire nation into digitally empowered society and knowledge economy. While education play a critical role in this transformation, technology itself will play an important role in the improvement of educational process and outcome. Thus, it gives a relationship between technology and education at all level, which is bi-directional. Use and integration of technology to improve multiple aspects of education will be supported and adopted, provided these interventions are rigorously and transparently evaluated in relevant context before they are scaled up. Next slide, please. Now, nursing education with digital era. Nurse educator use of technology in teaching continues to expand at a dizzying pace. It is hard to imagine now planning a course or a class without thinking about technology that might be used to engage students in learning and meeting other instructional goals. Next slide, please. One report from the Horizon report, which indicates that a shift is taking place across higher education in which students are learning by creating rather than consuming content delivered by the teachers. That means focusing on student-centered objectives. There was a news item in Nurse Educator that presented a simulation game called Terminex, in which a health provider played each other's role. For example, like how to give a care to a dying patient. Here the two teachers can make a role of a dying patient and other can be as a healthcare provider to give a depict a picture of how to give or how to take care of a patient in a dying state. There is another study by Amster and colleague which has used the eye tracking device for determining error of nursing student in simulation. They have compared the use of multiplayer virtual simulation for the nursing student to develop their leadership skills. Coming to the teaching tools with technology. Teaching with technology, however, is not about the latest tool that involve the decision of a nurse educator about when and how to use those tools. Those decisions should be based on the outcome to achieved, not because our technology is new and exciting. The main consideration in selecting a technology tool is whether it facilitates learning as it consistent with the goal of the course. With available nowadays mobile technology, nursing students would be able to access necessary information independent of time and place. I think you agree with this. Therefore, it is important for all stakeholders and educators to facilitate the use of PDAs to support nursing students during their clinical practice in order to prepare them for a future work and to continuously improve the safety and quality of the healthcare. A saying by Caroline, technology is not to be friend, it is only to be understood. Yesterday, one of our dignified speaker had spoke about the flipped classroom, and I think that's an important teaching tool can be used now, which is a pedagogical model in which a typical lecture and the homework elements of a course are reversed. Short video lectures are viewed by the student at home before the class session, while in class time is devoted to exercise, project or discussion. Mrs. Thankam has taken this session in a very knowledgeable way yesterday. Coming to the clinical practice and digital era. Bakul Patel has mentioned that we are taking a very light touch, almost hand-off approach. If you have technology that's going to motivate a person to stay healthy. I would like to just add a question asked by a participant regarding how digital technology can help us to be healthy. The most common example we can give of this Arogya Setu app. which has been centralized, developed by our Ministry of Family Healthcare. And today, with the use of this app, at least the COVID-19 patient census can be brought out, and this app can be used by the any layman person. Agree or not? Technology is used extensively to provide and deliver healthcare worldwide. I think I've explained with the example. E-health, the application of information, computer or communication technology to some aspects of health or healthcare, is viewed as essential for solving problem-faced healthcare system of increasing demand due to aging population and improved treatment with limited resource. As you all know that the normal age of the person, successful aging has occurred and it has increased now. Technology also exposes students to clinical scenarios that would not encounter in their practice and help them to bridge the gap between theory and practice. I think this also brought out yesterday by Professor Susan. She has given the example and how the nursing care plans and the nursing notes are based on the technology. And now the clinical pathways are also maintained, especially which are very useful tool for nurse practitioner working in the hospital. With technology, we can add reality to a scenario and make a traditional case study more elastic. A study by Rob described that how faculty can integrate technology in a case history. For example, by adding podcast, hyperlink, video clips, images to provide the contents for the case and engaging students in meaningful learning and develop their clinical skills. Philosophy of technology and nursing is a fundamental to discipline development and our role in enhancing healthcare. Nursing professional as important contributor to the use and integration of healthcare technology and identify nursing as a discipline in those society which was brought out by Mr. Reddy just now, that nursing is a very powerful and highly demand profession. Clinical practice guidelines are also an important source of information designed to help physicians, and it helps to integrate research evidence into the clinical practice. Digital education is used for clinical practice guidelines, dissemination, and adoption. So the aim should be to evaluate the effectiveness of digital education in improving. Coming to the nursing research and digital era, which was taken in a very elaborate way by previous speaker, by Bonita in 2004 mentioned the health of the population has improved significantly with the increase in the life expectancy and reduction of morbidity and mortality from infectious disease. So new technology involving artificial intelligence, machine learning, blockchain, smart board, handheld computing device, adaptive computer testing for student development, and other forms of educational software and hardware will not just change the student learn in the classroom, but also how to learn, and thus this area beyond will require extensive research on technology and educational fronts. That's a message we want to give to our all participants, to be technological savvy. Yes, we need to work out that how we can able to learn the updated technology, just not to run away. To conclude, the use of technology in nursing education and clinical practice, which is not recent, but this technology changes nurses plan, deliver, document, and review clinical care. So this will only continue as the technology advance. Technology has many benefits, but there are huge gap in technology access and training in nursing education and health setting, and challenges regarding the nature, cost, and the high turnover of technology used in teaching learning spheres. to prepare nurses for a challenge of complex dynamic healthcare environment, the faculty envision curriculum infused with the technology in motion need to be updated. Thank you. Jai Hind.
Thank you, ma'am, for a nice and excellent speech about the theme amelioration. So, dear participants, till now you were visualizing three speakers, and also including our principal, that how the digitalization being involved or it immersed in our life, right? So I will give 10 minutes break so that you can relax in your home and you can take your food or anything. After 10 minutes we can rejoin the session. If anybody needs to ask some questions, you can shoot out in the chat session. The speakers are all around. You can tell them. Participants, if anybody is having any doubt or any questions, you can make in the chat session, so that because speakers everybody's on online, so that they can reply to you people. So we can have 10 minutes break.
Because I'm still worried.
Welcome back, everyone. I hope you had your lunch or snacks or tea, anything, right? Okay, as per the demand of many participants that they need to see again the aviates exhibition, and also many of the participants have joined today. So we are going to retelecast that the aviates exhibition now. So just enjoy the show.
Good evening, everybody. Myself, Mrs. Shaheen Akhtar Khan, Associate Professor, Department of Community Health Nursing, feel privileged to bring into your vision the current and future teaching learning modes. The future scenario swims deep into augmented reality. The future generation gonna rise significantly in the years to come in almost all walks of life. This is a simple love story of art meeting technology and creating magic. The magic will get us into a completely different yet fascinating world. Creativity along with imagination, these are two important skills that boost augmented reality of today's scientific era. Augmented reality is one of the most promising digital healthcare technology and has the potential to change the healthcare in the days to come. During different eras of teaching and learning, including today's scientific era too, chalkboard is the basic and constant mode of teaching and learning. During the past 20 years, there has been a transition from the basic to the most advanced mode of teaching and learning. So here I introduce the PG students of PANNA Subharti Nursing College who will take you to the journey of transition. So here we move.
Good evening, good morning, everyone. So we are in a standing in the older era of AV8s that we have used chalkboard and chalkboard, green board, whiteboard, where we have started our AV8s, which is the best method we have ever used, and now still now also we are using the same. Starting from the rollerboard, we have moved to the maps or pictorial representation like that. Maps we have used, and we have moved to the puppet show, which we mostly used in the community area to represent the disease conditions and all. We have used the puppet show. And moving further to the projected aids, we have a slide projector in which we used to keep the slides in front of the screen and it will be projected in a wall. Then we have changed that into the TV. We have changed that into the TV or VCD player where video recorders will be there and things will be projected on the TV, and that is also another audio visual aid we have used further. And from the slide projector, we have just moved further to the OHP projector, otherwise overhead projector, in which we used some transparent sheets like this, and we are writing the teaching materials inside this with a permanent marker or temporary markers, and we'll be keeping on the slide projector, and which will be also projected on a screen. And then like that, several types of previous models we have used, and from there we have moved to the various pictorial methods or to a middle era where we have used both the things, that is both the several types of AV8s like non-projected and projected AV8s have changed the era into a medieval rate, and that will be explained by Ria.
So here we have a picture. In picture, we just show the causes, the symptoms, and the treatment of the diseases. Next, we have a flip chart. Flip chart consists of pad sheets in which we just stuck in, and it concludes all the subheadings of the specific topic. Moving further, we have a leaflet. Leaflet, we just take a sheet of paper and then we just write a topic of it. Like I have shown here the mechanism of flavor. Next, we have a bulletin board. It is mainly for the public message. Next, Pamphlet. Pamphlet is used by in a teaching, as it just be folded in 3 to 4 and just given to the student to have a great idea of it. Moving further, we have a cartoon and a comic. This represents to give. This is used to represent the main topic and just give some idea to the students. Next, we have a tree chart. As it is shown, the tree have a branches. So we have a specific topic, and from that, they divided in a subheadings. Like we have used method of data collection, and it is divided in mainly 5 parts. So we have shown it here. Next, we have a pie chart. Pie chart represent in a percentage, as it is shown the uses of Google. Next, we have a line graph. It is also a comparative in which we have a 2 points, and here we have shown a blood glucose levels vary between the type of a food eaten. It shows the elevation as well as the lower limits of the points we have taken. Next, we have a column graph. In column graph, it is represented in a bar graph, and it is also a comparative between the days, or we can take a countries, continents, etc. Next, we have a diagram. This represents anything which may be a disease, which may be a stages. It can be represented in anything. A pictorial graph. Pictorial graph is represented in a picture, icons, different emotions. Like here we have used emojis. Thank you.
From there, we are moving to somewhat to the specimens. Specimens means where we are giving some more clarifications to students by giving them an original view of the organs or original view of the body parts, so that they can be more clear about the body parts and also the disease conditions, what is happening to a particular human body. So the specimens are also one of the medieval parts in which we are using as an AV aid, because they are giving some more clarifications than any other types of charts or any types of models what we have used. From there, we are moving to the models. So simple models are there. First it has come to the notice in the form of simple models in which we are explaining, or if, for example, if the structure of brain means the parts, they will be projected, the parts and what all the parts are there, that will be projected, and that will give a more specific idea to the students regarding the particular organ. From there, again, we have changed that simple model has changed to working model. It has changed to working model in which we can show the students how a particular organ is functioning, For example, we are giving a working model of a kidney, and if you want to show, so if you want to show that students how the kidney is working, that the working models are there, that it will show that how it will be going, and it will be filtering and coming back to the through the urinal output. That is the working model. So same thing, the working model of heart is there. Like that, so many working models have replaced the normal models, so that the students will get a specific clear idea about the organs and also the systems of human body. From there, again, we have moved somewhat advanced to the simulation. Simulation means normally in medical fields, they are going to the hospital to have a direct interact with the patient. So before going to that, we have to give them a practical based knowledge through the simulation mannequins. So mannequins has replaced the models. Actually, if you say that, the mannequins has replaced the models, and it is something like a working model, but it is not a working model. But still, they will give a student an idea regarding the patient, and also for what all procedures they are doing, they can do in the dummy or they can do in the simulation mannequin, and then they can go and practice the same. So that is the newest method what they have approached. This is the medieval era. From there, we have moved further into the newest technologies of technologies that has changed it into the normal from the slide projector to it comes to the LCD projector, where there is no need of any types of model, there is no need of any working model, there is no need of any type of mannequins. You have directly you can go and show the students what are all things you need. If you want to show them the slides, what are the slides you can show them. If you want to show them videos, you can project the videos. If you want to show the procedures, you can show the procedures. So the technological advancement has changed a lot. From there, from the normal slide representation to the LCD projector, where the students can sit in a classroom and they can see what all things can happen are happening in the hospital. Even they can see that also, and they have changed it into videos. Their procedures you can show them as the video so that they will get a clear ideas. So that is the present era, and from there it is also for we this is also a newer era, but the technologies has moved further. It has moved further, and now it has come to virtual classrooms and also to the augmented reality. So let's see how the augmented reality works. So by using some peculiar glass, you can see you can select the organs which you want. So for example, I have selected the heart, so you can go into the heart, inside the heart, and you can see the valve and how the heart is pumping. And like that you can select any other part of your human body from a list of structures of your body. And again, I'm going to select the skeletal system, so you can see the skeletal system we have selected, and you can separate each part or separate each nerves also. And you can go into the structure, you can see the internal structure. So now let us move to the another aspect of virtual reality. So you can see a skeletal system in front of me. This is the virtual view of your skeletal system. So this is your skeletal system. This is the anterior view of your skeletal system. You can see your skull, you can see your thorax region, you can see your lower portions, lower extremities, and you can see in this lymphatic system, you can see, and also the circulatory system, you can see in this. So let me rotate it into the posterior view. Let it go to the posterior view. See, this is the posterior view of your skeletal system. You can see the pelvis clearly here. And also the same things, the posterior part of your vertebral column, you can see, vertebral disc, you can see. So this is the posterior view. And you can see the side, you can just rotate it to the side, and you can see the extremities there. You can see the extremities, lower, upper extremities, and also the lower extremities, you can see. Then again rotate to the anterior view. So like this is the virtual. Now this is the newer technology what we are using, that keeping the objects near to you and teaching you people. Thank you.
So till now you have been watching about the audiovisual exhibition and what is the augmented reality. So we have the next session on digital collaborative educational interventions in nursing. Ms. Amy Hussey, RN, National University of Ireland, Galway, University Hospital, Galway, Ireland. She has been trained in hemo and peritoneal dialysis. To, to have you on this day for this conference is our entitlement. Ms. Amy, the plenary is yours. Before you start, I welcome our Dean, Dr. Gita Parvanda, to greet you.
Hello,
Hello.
Jai. Yeah, we
Hello.
welcome you to the session.
Namaste. Thank you.
Okay, thank you.
We'll just switch it on. We can start.
Well, I'll start. Great.
Yeah.
So I'm just going to share my screen.
You're going to share the screen, or shall we?
Oh, can you share my screen, please? Yes.
Yeah. Okay.
That would be great.
Yeah. No. This one.
Yeah, this one.
Yeah. I hope you can.
Yeah.
Yeah, I can see it perfect. And will I be able to control the PowerPoint?
No, 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 no.
I'll ask you to.
Yeah, yeah. You can say next. No problem.
Okay, thank you very much. Thank you. Okay, so hello everybody. I'm Amy. I was introduced there. I'm from Galway, and I'm here to give you a PowerPoint and an introduction into the digital collaborative education interventions in nursing. It's something that's become more, I suppose, pronounced in education all over the world in the last while because of COVID-19. But it's always been there, and it's just to kind of give you an insight into what it's all about, really. So go on to the next slide, so. Great, thank you. So the factors that are going to be addressed in this presentation are the concepts of collaborative learning and the digital collaborative learning. We're going to discuss the socio-constructivist theory, which collaborative learning is based on. We're going to learn about the role of digital collaborative learning in nursing education and review studies which have been undertaken to support the effectiveness of digital collaborative learning. And then we're going to give a brief introduction of M-learning, which is learning through mobiles, and it's becoming much more pronounced now and much more used throughout the world. So collaborative learning is an umbrella term used for a variety of educational approaches involving joint intellectual effort by students or students and teachers together. It's groups of people working together to solve problems, complete tasks, and learn new concepts. So you're encouraged to work together, mutually searching for understanding, solutions, or meanings. And this is quite appropriate in nursing education and in every type of education, because in the real world, when you go out and you're nursing on the wards, in the hospitals, or being wherever you are, it's all about working as part of a team. And it's important to put your own opinions out there, because they could very well be the right ones, and to collaborate them with your workmates and other people of the multidisciplinary team to come up with a mutual understanding and knowledge based on all of your experiences. And that's why the diagram here is quite powerful, because it's everybody bringing their own positive and negative experiences and views and join them together to find knowledge based on everybody's experiences, really enriched. So collaborative learning is designed from the constructivist approach, which emphasizes the active participation of students in the learning process. And you can see here in the diagram, it's two ideas coming together to come up with the best idea. It's a belief that learning happens through a process of meaning and knowledge construction, as opposed to passively learning it in the traditional learning environment, which is what I suppose a lot of us are used to learning in and teaching in. The teacher stands at the top of the classroom, the students sit down and they watch, and they're told what to know and what they're supposed to learn. Whereas collaborative learning and the constructivist approach, indeed, are both used to encourage students to participate in their own learning. And as higher level educators and as higher level learners, we're there to support students in what they want to know, rather than telling them what they want to know, because it's much more effective learning when you have to kind of go out and find the information for yourself. And to learn through that, it's much more beneficial, particularly in nursing as well, where you're going to be learning every day on the wards. So it's helping you for your future career in nursing. So then digital collaboration is the practice of people working together through online means, such as software as a solution platforms, and the use of digital tools to address collaborative learning needs. So instead of only communicating and working together in person, we're encouraged to use these digital platforms. There's hundreds. You know, you have Microsoft Teams, you have StreamYard, which what we're on now. You have any amount of these platforms that best suit what you want to teach and how you want to learn. And they're just all there to support digital collaboration in sight of when you can't be in contact with people and when you're not able to join in gatherings. It's a much more beneficial way of still being able to do things as a team and together in large groups, but all through mediums of digital collaboration and joining together in that way. So with digital collaboration, the aim is not to replace the teacher, but to use the technology to increase and improve communication. So Teachers are still going to be there as facilitators to teach students how to use the software, first of all, because some of them can be quite difficult until you learn the right ways to go about them and that. And then also the teachers there to facilitate the sessions when they're happening as well, to make sure that they're effective and that what's supposed to be happening and talked about is happening. Students are encouraged and supported to work together, to create knowledge and to invent, to explore new ways of innovation. And in doing so, to seek the conceptual knowledge needed to solve problems rather than to recite what they think is the right answer. And this once again goes back to nursing careers. And it's something that's going to really benefit student nurses in the future, because when they're encouraged to work as a team, that's the height of working in a ward as a nurse. You're constantly working as a team, and you want to be part of that team. You don't want to sit in the background, because as nurses, we're part of the multidisciplinary team, but we're also the people that spend the most time with the patients. And our views on what we think are very important, and as is the rest of the multidisciplinary team. And with collaborative learning and digital collaborative learning, indeed, students are encouraged to work together to create this knowledge and to come up with their own new ways of thinking and doing things. So the role of the teachers and digital collaborative learning. Teachers play a key role, not as a fellow learner, but as the link to the knowledge community, like what we had just discussed. They're facilitators in making sure the software is available and students have access, and also then to facilitate the learning through the software. Learning is defined as conceptual change and is key to building knowledge. And that's really important, because I think sometimes learners, as learners, we have a tendency to sit in the classroom and just try and soak in as much as you can, but just to, you're kind of just sitting there and waiting to get the notes and then to go home and do your study, or you're waiting for the teacher's guidance and everything. But in collaborative learning is defined, it's a conceptual change, and you're changing your point of view on a topic or on a skill, or different kind of things like that. And it's key to you building knowledge on that. And when you build it on what you have research on and what you've done and what you've built on yourself, it's much more beneficial knowledge, and it's going to stay there for it's long term. It's gone into your long-term memory. So learning activities are informed and guided by the norms of the discipline and a discourse process that emphasizes conceptual learning and builds knowledge. Digital collaboration and nursing education then. So the continuous increase and ease of accessibility of information, together with rapid changes in working and everyday challenges in nursing education. So traditional learning is face-to-face and can be time-consuming, costly, and inaccessible. Particularly in today's climate, it's inaccessible. Face-to-face learning can't happen in the physical sense. So where institutions have been, they've been forced to think outside the box. And although digital collaboration has been in the pipeline for a long time, it's still important for us to focus on the fact that it's the only way to go about things now. So it's what's going to have to become the norm. And, as part of nursing education and all education, it's going to have to be become a norm. So, printed self-learning resources are easily overlooked by busy healthcare professionals. And, we all know it. You get printed off stuff, it all goes in, like most of it can go in the bin or get mislaid. So at least when you're doing a digital collaboration or you're learning through digital devices, it's going to be there, and it's much more accessible as well. So talking about that again, so it's increasingly employed in continuing medical education and professional development. Digital collaboration offers a more flexible, affordable, and accessible alternative to traditional learning, as it transcends geographical and time constraints. So, a lot of the time, I know particularly in Ireland, and I'm sure it's all over the world, students choose a nursing college or, that's close to home, or that's far from home if they want to go far from home. But it's often locality is the reason why you would choose your college and your nursing school. Whereas if it's being taught through digital collaboration, students have more of it, they're much more flexible at where they can go to college, because they're learning through a platform rather than learning through the locality of the place. Digital collaboration can also be used in diverse media and delivery devices. It allows for interactive and engaging learning resources that can be easily updated with new evidence and customized to the individual healthcare professional learning needs. And that's also an important aspect, because through in medical healthcare and research and that, it's been updated continuously. It's never mind daily, it's probably hourly, that research is being done, and protocols change and policies change. So when you have it on a digital device, it's much more accessible and it's much more reliable for the people using it, that it won't just be it won't be inundated or outdated, because it can be constantly updated. So nowadays, students need to develop greater skills of various kinds, including innovative thinking, effective working, and digital tools management. In today's society in general, people fall behind if they aren't updated with digital learning and digital tools, because it's becoming such a big part of people's lives. So it's really important to keep updated, and students need to be given that opportunity to continuously update their skills of innovative thinking, effective working, and digital tools. So exposure to strong collaborative-based problem thinking, critical thinking environments, and working in complex new patient-centered situations that directly exploit existing knowledge and demand further thinking. And that's really powerful, demanding further thinking, because you don't want to just be learning on the surface. In the hospitals, and when you're in an emergency situation, or indeed just a normal patient care situation, you need to be able to think further than what you can think, beyond what you can see, and also be constantly questioning what you see and what you think because it's always going to benefit the patient. And when you're constantly thinking and updating and critical thinking process, you're involving that in it, it's always going to benefit you and indeed your patients. So the socio-constructivist theory, collaborative learning is strongly based on this theory, and it's a sociological theory of knowledge according to which human development is socially situated and knowledge is constructed through interaction with others. So that's what we've kind of been talking about so far with the collaborative learning and learning in groups, and everybody bringing their opinions forward to come up with knowledge based on experience. So in this socio-constructivist theory, learning is seen as a process where individuals' knowledge and understanding develop through supportive interaction with peers in a learning community. It's built on common group understanding and guidance of others. So it's a massive point of it is everybody pulling their weight and everybody working together, because as often happens with group work, there's always somebody that will take the lead, and then there's always somebody that might take a back seat because there's a leader. So it's important to make sure that everybody is putting in their supportive interaction with their peers in a learning community. And construction of one's learning begins with engaging learners in the meaning-making process and ends with enabling them to handle real-world problems. So what that means is that the construction of your learning begins with engaging learners in the meaning-making process. So that's moving away from your traditional classroom again. It's from making your own knowledge from resources given to you by your teacher. And that's how teaching is changing, because you're no more standing at the top of the classroom telling the students what to learn and what they should know. You're giving them the tools necessary for them to make their own decisions, and then enabling them to handle real world problems, because they're basing what they know on solid knowledge and research. The socio-constructivist theory also emphasizes the role of social interaction in individuals' learning and knowledge construction. So it's placing, a lot of worth on the role of social interaction and, linking in with others, which is another thing that can't be done right now because of social distancing and COVID-19. But that's where digital collaboration comes into it, because it's always going to be there and it's always accessible. It's just having the right mediums and the right platforms in order to do that. So the socio-constructivist is a student-centered educational paradigm that releases students' autonomy and freedom using collaborative learning approaches. It considers learning in a result of disagreement between 2 points of view in social interaction, coordination of 2 points of view, resulting in an enhanced learning at an individual level. And that's the diagram here in the middle. So two individuals are coming together. They both have knowledge and they both have previous social experience. They're coming in together with a transaction and they're negotiating their meanings that they both hold already by listening to the views of the other individual. And through that social interaction, you have development of new language, perspective, and indeed action. The verbal interactions activate several cognitive processes, including perception, comprehension, information processing, and representation and anticipation, among others. And that's really important. It's for you to allow your views to be heard so that you're benefiting the other individuals in your group and the other individuals that you're working with. Because through verbal interactions, you're activating several cognitive processes within yourself and also within your peers. Digital collaborative learning, then, it's a goal-orientated activity of a group of students committed to achieving a common goal and interactively creating new knowledge in digital learning environments. So it's sharing arguments and processing ideas. And once again, this is coming through from the views from the role of the teacher in digital collaborative learning. They need to encourage students. It sounds bad to say encourage students to argue, but as such, they do need to encourage students to put their points across and to not be afraid to go against the grain with their knowledge, because they could be the very one that's going to, to bring the knowledge to the next level as such. It's cooperation, knowledge and building. It's shared problem solving, support development of future working life skills with group level regulation processes. So you make your rules, you develop your rules at ground level, and then like the teacher's role is to ensure that the rules are upheld, and then also to continue them throughout the session so that everybody gets a fair chance to deliver their views and to share their arguments, thus starting the process of ideas. So digital collaborative learning research, So digital collaborative learning research focuses on the possibilities for digital technology to enhance collaboration and interaction between learners, involving in group work and sharing expertise. Virtual learning environments such as Moodle enhance social interaction, since collaboration is a desirable working method on these platforms. It's also the only means of making these platforms useful and utilizing them in the right way, because you can't go onto these platforms on your own, because it would be a waste of time. The reason you go onto these platforms is to link in with other people, to collaborate, to work together, and albeit you'll be holding meetings, teaching, whatever it is, you're working together for a shared goal at the end of it. Digital collaborative learning is not a spontaneous process, and pedagogical scripting is needed to enhance interaction and productive knowledge. So there it is again, the role of the teacher in digital collaborative learning. It still needs to be sought out, like you would plan your lesson plan in your classroom or you'd plan your session. It's still very important, and it still needs to be done in digital collaborative learning, because it still has to have a structure in order to maintain the concentration levels of the students and to make the session interesting to ensure learning occurs. So nursing reflections, there's been research done which shows that digital collaboration promotes nursing students' reflection on experiences and thinking together with peers, leading to deeper understanding of information and skills. So Previous educational studies show that students have difficulty effectively planning, monitoring, and adapting to collaborative efforts. But once that collaborative effort is made, they're easy platforms to navigate. And interaction during collaborative learning has both cognitive and emotional aspects. So that's something that's been researched and proven, is that nursing reflections often happen in a very effective way through these platforms and through digital collaboration, because it's a way to interact with other people who are in the same situation that you may not get a chance to meet only through these platforms, and just reflecting on your practices and your experiences. To support collaborative learning, learning environments should have a student-centered design, taking into account factors that prevent and promote collaborative learning, including socio-emotional aspects that promote or hinder productive collaborative efforts. And this is appropriate for all levels of nursing education and indeed nursing. If there's a situation that may cause a patient or a colleague or a student to feel emotionally distressed, or that they need debriefing or anything like that, this is basically what this slide is saying. Like, to support collaborative learning, they should have the environments should have a student-centered design and taking into account factors that may prevent them from learning. So it's always important to take them into account. So factors that affect collaborative learning negatively. So we kind of touched on this before, and it is important to always consider these, because we've all seen them happening before. So factors that affect collaborative learning in a negative way include unequal participation of students in joint work. So that's a role of the teacher to ensure that all students are engaged and that they participate equally in the session. And also insufficient coordination, that's once again is the teacher's role in educating them and in holding the session and making sure it happens in a coordinative way. An inappropriate division of labour and technical problems. Inappropriate division of labour is one student gets caught with too much, or maybe time schedules haven't been analysed enough and thought about. Technical problems, they're inevitable when you're using digital devices and technology. So it's important to kind of make sure that they're not a hindrance. And careful planning and further investigation are needed to address such obstacles and to optimise collaborative learning opportunities. I had included a YouTube video, but I don't think will it be able to be played? If not, it's okay. It's just linking through all the effects of collaborative learning. Yeah, that's okay. Thank you. We talk about everything anyways. It's just bringing it together. So the effectiveness of collaborative learning is, there's no definitive proof that collaboration in digital learning environment promotes learning more effectively than collaborative practices in classrooms without digitalization. But I suppose in today's world and in today's society, there's no way around collaborative learning only through digital learning environments. So there's been no kind of research as such done that promotes collaborative learning with digital or more. Is it possible to play? If it's possible to play the video, it'd be good. Sorry now. Thank you, that'd be great, yeah.
We are trying to play your video.
Thanks a million if it's possible. I'm awkward, I'm sorry.
No problem. We are trying to play your video.
Great, thank you.
Work failed, he missed deadlines, and didn't learn from mistakes. But chances are you've also been part of a team when you accomplished something epic together that you could have never done on your own. So what makes this creative collaboration work effectively? Well, here are 7 ideas. Number 1, ownership. Members need to be empowered from the start. Here they can solve problems, generate ideas, and design systems that lead to success. Number 2, dependability. Creative collaboration requires members to hit their deadlines and develop creative endurance. Number 3, trust. When members trust one another, they work interdependently. Here they genuinely listen to one another and assume the best in each other. Over time, they become transparent and even vulnerable. Number 4, structure. The structure should be loose and flexible, but you need to have structure in creative collaboration. It needs to exist. This is why I love design thinking. It's a flexible framework for getting the most out of the entire creative process. Number 5, a shared vision. I'm not referring here to vision statements that you put on a wall or slap onto your website. I'm thinking more in terms of a sense of direction. It's a shared desire, a goal that you're aiming for, and a picture of what you will produce. Number 6, fun. The best collaborative groups I've been a part of are the ones where you want to be together. They laugh, they play together, and this can actually boost both convergent and divergent thinking. Number 7, candor. This is one of the big takeaways from Creativity Inc., a book by one of the co-founders of Pixar. It's the idea that groups need to be honest about what's working and what's failing. And this honesty allows you to adjust and iterate and ultimately create something awesome.
Thanks for that.
Okay, shall we continue the slide, Amy?
Sorry?
Shall we continue the slide?
Yes, please do. Yeah, thank you. Thanks for that. Thanks. Okay, so that video was just kind of bringing it all together and showing the importance of collaborative learning. And it's very straightforward stuff that we all know should be happening and we all try to make it happen, but it's just important to encourage it, and as being, it's not all left down to the teacher. Each individual that's part of the group has a role in ensuring the effectiveness of the collaboration and the learning group. So yeah, this slide was just about the effectiveness of the collaborative learning and saying that there was no clear, definitive, definitive proof that because students used in the digital tools in the learning classroom, that they're any more effective than collaborative learning in traditional classrooms. But just in today's society, it's the way forward, and it's the way that things are being done. So digital collaborative learning has received more attention in general education science research than in nursing education research. And that's just a way that the research has gone now. I have a few studies that show that are relative to nursing education that we'll be discussing in a few moments. But the fact that there's been more attention in general education science than in nursing education may be significant because nursing education involves integration of theoretical knowledge into authentic work-related training with interprofessional teams taking essential decisions in patient care. And that's hit the nail on the head of what we've been kind of talking about the whole way through. Nursing education is so important, integration is so important in it, and collaborative teamwork, group work, interprofessional relations, because it's essential in decisions and patient care. Digital collaborative learning could potentially facilitate students preparation for future professional settings by helping them develop self-directive and cognitively flexible competence to deliver patient-centered care in effective collaborative environments. So that's once again showing how important collaboration is in nursing research. And also I know certainly in Ireland, hospitals are becoming much more computer-based, and paperwork is becoming a thing of the past. I'm sure over in India it's much more advanced than in Ireland. We're always a bit slow off the mark. But, it's important for everybody, for students to be taught this in nursing college, because otherwise they're going to land onto the wards and be in charge of patients and documentation and not know how to navigate these systems. So it's an important part of nursing education today. More knowledge is needed to identify effective educational interventions for enhancing nursing students' collaborative learning in digital learning environments. And I suppose in the world of learning and teaching, digital collaboration is still quite a fairly new topic. So there will be ongoing research on the effectiveness in that, indeed, particularly in nursing education. So the relevance in nursing, then again, we'll go back to it. So nurses nowadays require collaboration, client orientation, service guidance, quick decision making, and the ability to use digital technology. And I know I feel like a broken record saying it, but it's just so important in nursing, because I certainly found in my nursing course, it wasn't something that was kind of covered much. It was kind of more part of a module, the interpersonal relationships and that, but it was never covered in the way of too much meaning, or there was never too much emphasis on working as part of a multidisciplinary team and communication skills, which are invaluable in nursing, and they're necessary. Students nowadays, or nurses, are expected to have competencies in problem solving, fluent interaction with patients, and social skills to face challenges of rapidly changing healthcare system. So educators have recognised the need to develop teaching practices that help nurses meet these challenges. So students are encouraged to think critically and creatively, to learn independently and function effectively in collaborative multidisciplinary teams. So this diagram says it all. It's basically, it's clockwork. It's continuously happening in a cycle, these critical thinking skills. So you can start from wherever, because it's all continuously happening and it's all coming up with your final reasoning. So you have your reasoning, you're evaluating, you're solving your problems, you're making your decisions, and you're analysing all that information, and then you're reasoning, you're evaluating, and it's a constant cycle, but it needs to be constantly happening, because we're gone past the stage and the days when you can just accept something for what it said. And I know sometimes as a student nurse, I know from working in a hospital in Ireland, certainly, you often take the doctor's word as gospel. And I think it's important, and sometimes doctors take nurses' word for gospel, and sometimes, and vice versa with your physios, OT, speech and between the whole multidisciplinary team, you always need to be critically thinking, and you can't ever just assume something. So it's always important to double check everything with yourself, with your colleagues, and with the person that's trying to say something to you. Or it's important to always be evaluating what's been said and what you're hearing. So the effects of digital educational interventions on collaborative learning in nursing education. So now, so these are the few studies that have been done. So a quasi-experimental study was undertaken, and there was an interventional group which studied using collaborative learning environment, and a control group that studied in the traditional classroom setting. In this study, there was no significant difference between the groups in terms of student satisfaction. However, the intervention group, which were the group that were studying using collaborative learning, had higher satisfaction in the area of promoting collaborative group work and received statistically higher grades. And that's a really interesting point, because students can learn so much from each other, and it's often underestimated. Teachers can learn a lot from students. It's a group effort, and everybody's learning. Every day is a school day, so everybody needs to be open to the learning experience and new knowledge and how it's being processed. So that's kind of what that study has proven. So you have it there. The study emphasises the collaborative digital learning can be an effective approach in nursing education in terms of learning outcomes, and ensure that they're being met, and that they're being met in a way that students remember the knowledge and that they're learning in an effective way. More research, however, needs to be undertaken on the role of the teacher in collaborative digital nursing education. A study in 2020 by Merger Benisto et al. conducted a systematic review over 5 different research studies. And over the 5 peer-reviewed studies that they researched, there were 647 participants. They were reviewing digital collaborative learning in nursing education to evaluate its effectiveness. This study indicated that digital collaborative learning increased students' knowledge and nursing skills. It enhanced nursing students' interaction and collaborative skills, their problem-solving skills, satisfaction and motivation for learning. So once again, it's collaborative learning, and indeed digital collaborative learning is being supported. And this is a very recent study. So it's been done since COVID, and it's when students are being forced to learn in the digital collaborative environment. But it's shown that there's a massive impact on students, and it's a positive one, which is positive. So evidence-based digital collaborative learning is becoming increasingly effective in nursing education as valuable tools and teachers' abilities are improving, providing new learning activities to boost students' learning outcomes in higher education. And then I just have the pop-ups there now on the slide. It's, you know, so knowledge is being taught through collaborative learning. I think there's 4 of them, yeah. So the students' competence is being questioned all the time by the students and by the teachers and by their peers, but it's also being supported all the time. And that's very important to know, that this critical thinking and the critical appraisal of each other, it's not meant to affect students in a negative way or affect anybody in the class in a negative way. It's all for self-building and self-maturity. Satisfaction. So students' satisfaction in the learning classroom has been improved through the digital collaborative environment. And that's what Benisto found in their study, that student satisfaction through their learning. And I suppose you're taking out the fact that students have to travel to their college to learn. And I know there's a social aspect to it that students are missing out on from not being able to travel to college or to their university or learning area. But it's also important to note that students have more time to study and more time to focus on their learning and what they're actually there for, when they don't need to make the journey and essentially waste time. And to improve their problem-solving skills, which is massively important in their nursing education. So through collaborative learning, students are being forced to involve themselves in their learning, being forced to work together, being forced to express their views, and then come up with new views based on their own knowledge and the knowledge of their peers. So then we have the mobile digital education, and this is still a fairly new learning experience. I actually hadn't heard of it until I was researching for this presentation, and it's quite an interesting one, and I think it will become definitely beneficial in the lives of students, and it will be successful because it's very kind of effective. So it's a potential solution to the worldwide shortage of healthcare professionals. It's making learning more accessible for students. It offers an opportunity for wide access at low cost and flexibility with the portability of mobile devices. Now, we all live busy lives and we all have things on at different times, less so now because we're not allowed to do much else. But with the opportunity of mobile digital education and being able to learn through your mobile phone, it's going to open up a lot of gates for students, and it's a very positive development in the educational world. So this is a study by John Levy et al. 2019. So they conducted a systematic review and a meta-analysis where they reviewed 92 peer studies. And what they got from the peer studies was evidence suggested that M-learning is as effective as traditional learning, or probably more so. And that's quite important to capture because, you know, a lot of people still like the classroom setting, and there's nothing like sitting in front of the teacher and learning. But things have changed, and things are going to continue to change. So students and people need to be open to these changes. And through M-learning, it's as effective. And I think when more research is done on things like this, students will be much more open to them. And the fact that they'll be effective as the fact that there's proof that they're as effective as traditional learning, students will be more open to them and for them to be developed. So the conclusion to the presentation today really is, so the role of digital collaborative learning in nursing education is evident from what has been discussed. So it's clear to see that it has a massive role in nursing education and in preparing nurses not only for the knowledge that they need to know for the wards and for their working professional life, it also prepares them for developing problem-solving skills, critical thinking skills, teamwork skills, and communication, and working as part of the multidisciplinary team. In today's society, is becoming an increasingly popular platform for nursing education. And there's a necessity for ongoing research to study the effectiveness for its role in nursing education, and also to research all the new platforms that are out there, such as M-learning and that, to see their effectiveness and to find, I suppose, proof for them to be utilised in the future. So yeah, that's all that I have for you today. I hope you enjoyed the session and you got some insight into digital collaboration for nursing. Thank you for listening.
Thank you, Amy.
Thank you. Thanks for all your help.
It was an astounding spell that you escalate in every nursing individual.
Sorry?
It was an astounding spell that you escalate in every nursing individual. So once again, thank you very much for your companion towards our conference. It's our pleasure to have you today.
My pleasure to be part of it. Thank you. And good luck with the rest of it.
Okay. Thank you. Bye-bye. See you.
Bye now. Bye-bye.
Bye-bye. So the sessions of this day is being ended. Now we'll go to the next one about the scientific paper presentation. We have two scientific paper presentation today. One is Jyoti Kapoor and another is Pooja Kasturkar. So I want, okay, Jyoti Kapoor, welcome. That you can unmute your mic.
Yes, sir. Yes, sir.
Okay. So you have to, I think you will share your slide. Yes?
Yes, sir.
Okay. You will be given only 7 minutes.
Okay, sir.
So you have to project the statement of the problem, objectives, your methodology, and your discussions and limitations. Just enough, right? Other than that, you don't want to explain more things, right?
Okay. Sir, I am audible?
Yeah, you're audible. You're audible. Just wait.
Okay. Shall I?
No. Let the evaluator join.
Okay.
Just wait.
Okay, sir. Okay, sir.
Yeah. Nageshwar sir, it's Jyoti Kapoor. She'll be presenting.
Yeah.
So Jyoti Kapoor, you can share your screen.
Sir, I have shared.
No. Just open your PPT, then go down share screen, where you can see there. Just click the share screen. You'll have application window.
Yes, sir.
In application window, you'll have your PPT. Have you opened your PPT first?
Yes, sir. I have opened it.
Okay. Then go with share screen at the down. There you have application window.
Yes, sir.
I think, yes, yeah. Yes, you can make it as a slideshow. You can make it as a slideshow.
Okay, sir.
It's gone.
Mr. Anand,
Yes, sir.
what is your lot number?
It's lot number 4.
4. Okay.
Lot number 4.
Sir, now I'm visible.
You are visible, but your slide is not visible. You open the PPT first, then go to share screen. What you have done here.
Share screen. Application window.
Yeah.
Sir, is it working?
Yeah, we can see the PPT, but it's not in slideshow.
Okay.
Yeah, make it smooth.
Now, sir?
No, it's just like a PPT only, not slideshow is not being viewed.
Sir, but in my laptop it is looking like slide share.
Make Alt tab. Press Alt tab. Press Alt tab.
It is on slideshow mode.
Slideshow from beginning you.
Sir, I have done it.
Anyway, go ahead. No problem.
No problem. You can go for.
You
Okay,
have
okay.
7 minutes. Miss Jyoti,
Okay,
you have
thank
7
you, sir.
minutes. Okay.
Yes, sir. Yes, sir.
Yeah.
Sir, shall I start now?
Yes,
Yeah,
start.
you can start. Your time starts
Okay.
now. 7 minutes you have.
Okay. Good afternoon, everyone. Myself is Jyoti Kapoor, and I have done MSc Nursing in Gynae and Obstetrical Nursing. And first of all, I would like to thank the Subharti University for giving me such a wonderful opportunity. So, without wasting any time, let me start with my research statement. So, my research statement is an experimental study to assess the effect of infrared light therapy on episiotomy wound healing among postnatal mothers. The objectives are like to evaluate the effectiveness of infrared light
Your
therapy.
slides are not changing, Jyoti.
Sorry, but it is changing on my laptop, sir.
Mr. Anand, can you please let me know whether slides are changing?
No, it's still the first page only. Yeah, now it's
Now it is changed. I think it is taking a lot of time to.
Okay. This is okay.
Sir, should I continue?
I think your internet connection is the problem. That's why it's taking time.
Okay, now this
Sir,
is
actually there
statement.
is a 2G network facility in Jenkins.
Okay, you can continue.
Continue.
Research statement. Yeah.
Okay, research statement and experimental study to assess the effect of infrared light therapy on episiotomy wound healing among postnatal mothers. Objectives are like to evaluate the effectiveness of infrared light therapy on episiotomy wound healing among postnatal mothers in experimental group to compare the episiotomy wound healing among postnatal mothers between experimental and control group. The hypothesis of my research statement is like there will not be a significant difference of episiotomy wound healing between experimental and control group. So, according to June 2016 data, episiotomy is one of the most commonly employed procedures for the women delivering in tertiary care hospitals in India, with an overall episiotomy rate of about 70%. According to WHO, in the selective episiotomy groups, episiotomy rates range from 8 to 59 in median groups, and in routine or liberal episiotomy groups, they range from 51 to 100. According to various research studies, infrared light has a therapeutic effect in increasing the blood supply and relieving the pain. Infrared rays also have the physiological effect on the cutaneous vasodilation due to liberation of the chemical vasodilators, histamine, and similar substances, as well as possible direct effect on the blood vessels. Use of lamp 5 to 6 minutes per session, 2 to 10 times per day. The infrared lamps requires a voltage of 220 to 250 volts and should be kept 50 centimeters away from the affected area, and moves the lamp around the area during the treatment. Allow the area to become as hot as one can comfortably tolerate. The methodology of my study is: for the present study, quantitative research approach and quasi-experimental research design I used. The research setting was Government SMGS Maternity Hospital, Jammu. The sample selected was 40 postnatal mothers, 20 in experimental and 20 in control group with episiotomy. Purposive sampling technique was used to select the sample. Target population was the postnatal mothers who were having right or left mediolateral episiotomy. Inclusion criteria: the age was between 20 to 26 years, hemoglobin level should be more than 10, and albumin level should be 3.5. Exclusion criteria was those who were having age less than 20 and more than 26 were not included in the studies, and any comorbidities like diabetes, obesity were not included in the study. Tool for my study was sociodemographic profile, which included the items like age, education, occupation, family income, residence, religion, and dietary patterns. Part second was the obstetrical history variable tool, which included the item like the type of episiotomy, parity, antibiotics prescribed, suture materials used, and hemoglobin level. Section B of my tool was the standardized observation scale, that is reader scale, for assessing the healing of episiotomy. It consists of five main assessment areas like redness, edema, ecchymosis, bruising, discharge, and approximation. Each area is given a minimum score of 0 and maximum score of 3. The total score was 15. It is scored as: no infection was given 0 marks, infection was given 1 to 5 marks, moderate infection 6 to 10, and severe infection 11 to 15. The results of my study was: firstly, I will tell about the frequency and percentage distribution of demographic variables of postnatal mothers, which shows that maximum were in the age group of 24 to 26 years, and maximum were having this secondary education and occupation. They were homemates or housewives by profession, by work. Family income was between 5,000 to 10,000, and similarly having 15,000 to 20,000. Mostly were residing in the urban areas and mostly were Hindus by religion. Dietary pattern were mostly were the vegetarians. So according to abstractical history, 12 maximum 12 were having right mediolateral episiotomy, maximum were primiparas, and they all were using was given with broad spectrum antibiotics and having no absorbable sutures in their episiotomy, and all were having their hemoglobin level more than 10 and albumin level more than 3.5. So the section second tells about the effectiveness of infrared light therapy on episiotomy wound healing among postnatal mothers in experimental group, which shows that on day 1 the mean and standard deviation was 6.4 and 2.1. On day 2 the mean and standard deviation was 2.5 and 1.3, and on day 3 0.42 and 0.6 were the mean and standard deviation. When p-value was calculated, it was like 0.000, which means that p-value is less than the 0.005. That means the hypothesis was rejected, and infrared light therapy was very effective in wound healing of the postnatal mothers. When we check the frequency and percentage distribution of infection in experimental group, on day one there was one female having infection, and on day three there was zero female on day one and 13 females on day three. Mild case, in a mild part of the infection, six were there on day one and seven were there on day three, and in moderate infection, 14 was on day one, and there was none of the female having moderate or severe infections. In section 4, episode में wound healing among the postnatal mothers in control group. Control group was given the routine facilities or routine treatment, whereas the experimental group was given routine treatment as well as infrared light therapy. On day 1, the mean and standard deviation was 8.7 and 2.3. On day 2, it was 4.4, 2.1 and 29.0. On day 3, it was 1.0 and 8.7. When p-value was calculated, it was 0.000. That means routine examination or routine treatment was also effective in treating the wound healing in control group. When we take the frequency of and percentage distribution of the infections, so
Jyoti, you have one
on
more minute to go.
yes, sir. Yes, sir. Severe infection. 25 were having severe infection on day 1, and on day 3 there was none of the female having severe infection. So discussion of my study is, this study reveals the highest mean score of 6.4 to 2.1 mean and standard deviation, which was obtained on day 1, and lowest mean score was score was 0 to 0.6. Study was also done to assess the infrared light therapy on episiotomy wound healing, which concluded that infrared light therapy is appropriate method to care of the woman. And second objective was to compare the episiotomy. The study result showed the highest mean was obtained on day 1 and lowest on day 3. A similar quasi-experimental study which also revealed the same results. So limitation of my study was that it was difficult to make ready postnatal mothers for infrared lamp therapy, as it was a new treatment for them. And recommendations are, similar study can be undertaken with a large sample to generalize findings. A study can also be conducted in different settings, private hospitals and primary healthcare centers with similar facilities. And a comparative study can also be conducted between the primiparous and multiparous women to assess the effectiveness of infrared lamp therapy. My study concludes that infrared light therapy is an effective way to enhance the healing of the episiotomy wound, so it should be encouraged as a routine care in the hospitals. Thank you.
Thank you, Ms. Jyoti. It was very good presentation, except
Thank you,
you had
sir.
some technical problems from your end.
Yes, sir.
I would like
Sir,
to
actually,
have...
4G net is not working in J&K state. Na 2G net
Yeah, I understand.
is only working over here.
I understand. I understand.
Yes, sir. Yes.
So you are working now?
Yes, sir.
Okay. So I would like to ask few questions. Why did you choose
Yes.
quasi-experimental design?
Sir, I have selected quasi-experimental design because in quasi-experimental design, some of the factors you can control and some of the factors you cannot control. So when I selected this study, I thought I should give treatment to one group and then check the routine effect of the routine treatment on other group. That's why I chosen this design.
Why? How did you choose the sample size?
Sir, sample size I selected because of the availability of time for me, and there was I have to do my duties also, and so that I have selected 20 in experimental and 20 in control group. Whenever I used to go to the hospital, every day I used to select only 2 females, one in experimental group and one in control group. So it took nearly 2.5 months for me to complete the study, to choose the sample completely.
What is the sampling type you used?
Sir, purposive sampling technique.
From where did you get this standardized tool from?
Sir, I have reviewed so many literature, and from that I also selected, and from internet I checked all the reviews and all the parts of this tool, so that I selected that tool.
Okay. Did you accept null hypothesis or did you reject null hypothesis?
Sir, I reject null hypothesis because I have taken that there was not much effect of infrared on this postnatal mother's wound healing, but it showed the effect of infrared on wound healing. So null hypothesis was rejected.
Okay, tell me in one sentence, what is your satisfaction about doing this research?
Sir, my satisfaction level is good because in that hospital in which I have done studies, there are a lot of crowd, and women are not getting so much of care that they should get. So by doing this a small procedure, and we can include this procedure as a routine care, women can get a very good and better result than normal routine care. So I am
Okay,
very
fine.
happy.
Okay, fine. I would like to give you a few suggestions here. Now you have done this
Yes, sir.
study as
Sure,
a
sir.
part of your PG. You can note it down if at all you are interested. See, anytime whenever you are doing research, research
Yes, sir.
study should not be compromised. Methodology should not be compromised for our convenience. Right? So first thing
Okay,
is
sir.
quasi-experimental. You could go for always randomized control trials instead of quasi-experimental studies. So just because
Okay,
your
sure,
study
sir.
is not, your time is not demanding you to get into, you should not compromise research methodology. Always
Okay,
you should
sir.
aim for doing the better quality studies. Quasi is a little bit lesser than RCT, so better go for RCT. Then whenever you do
Okay,
the
sir.
studies, you always have to have a habit of calculating the sample size, because whenever you wanted to do something, it is always necessary that you should weigh what results will come when you have some kind of estimation. Because with a kind of 10 or 20, I don't know whether you're going to get the results whichever intended to get. The intention of outcome is something which is similar what you have got it, but for that, is it necessary, is it 20 is enough, we don't know. Neither you nor me, nobody knows. So at that
Okay,
time, it is necessary for you to calculate the sample size and go ahead. Always go for randomizer sampling, randomizer control, random sampling. Don't go for purposive sampling, because there will be a bias. Then standardized tools means it is already standardized and psychometric properties are already been tested and it has been published. Such type
yes,
of
sir.
tools have to be taken, and then that tool have to be modified according to the local standards. Then you have to go ahead. Now, since you have done
Okay, sir.
this study during your PG, I cannot ask you to do a perfect study. But future, whenever you are going to do the studies,
No, sir, it is
please
not
keep
my
this.
PG study.
Then
Sorry, sir, it's not my PG study. It's just a study I have done.
then actually you would have taken much care about the study, because during PG you have a time limitations, but during this time you should explore the better things. Don't go for quasi. Don't
Yes,
see
sir.
when you have to go for quasi, when the study setting is not allowing you to go for RCT. Steady setting is
Yes, sir.
not possible in it is not. No, steady setting itself is not possible. It is not for your convenience. Research methodology is not for our convenience. It is for the convenience of the availability of the sample and the setting and the administrative permissions. Do you understand?
Yes, sir.
Now, I'm not saying you have
Yes,
done
sir.
wrong things. Things we will do wrong to get it right. Now, always we do the
Yes, sir.
things wrong, then we get it right. Now, we all have done these type of things earlier, and we corrected ourselves. So, if at all you are much interested in research, never compromise your research methodology for the personal convenience. That's what I
Yes,
can
sir.
say. Any research
Sir, I'll take
methodology
care of.
has to be developed in such a way that it should be demanded by the sample, and it should always be demanded by the setting, not our timing, not our personal convenience. This is what I can
Yes,
say.
sir.
And if I can say, there will be many things I can say, but now I don't have that much of time to say. Let us see if at all we will get it connected, then you can do better researches. Okay, all the best.
Sure, sir. Thank you so much, sir. Thank you.
Thank you, Jyoti,
Thank you, sir.
for your information. And we are waiting for the next presenter, Pooja Kastukar, whether she's online. So we are waiting. It's lot number 5.
Okay.
We are waiting for her to join. She joined but lost her connection. We are waiting for her. Just a minute. So she lost her connectivity.
Okay.
So no problem. We'll conclude the session.
Okay. Never mind.
Okay. Thank you so much, sir. Thanks so
Welcome.
much for.
Welcome. Anand. It's my
Okay.
pleasure.
We'll see you tomorrow again.
See you. See you. Bye bye.
Okay, sir. Okay. So, dear participants, it's evening. I hope you all had a nice session from post lunch. Until now, it's a tea time. I hope you enjoyed the session, the second day, from 12 noon till now. It's our pleasure to have this, and have a nice evening. And we can join tomorrow at 12 o'clock. So be ensure that you are online tomorrow. So with this, I conclude. We'll meet tomorrow. Bye bye. Take care.